Hi guys, welcome to image based question session of surgery. So we are going to discuss most important images which are going to be asked in NEET PG as well as FMG, and these images are from the last 5 years questions which were asked in NEET PG and FMG. So let's start guys. Can you tell me what is the name of this condition? Tell me the diagnosis. Yes, Tashmina, Khushi, Ronak, Sachin, Rohit Yadav, Dr. Irresistible. So guys, can you tell me what's the diagnosis here? Yes, this is Pudgy orange. Can you tell me what is the cause of Pudgy orange? This is Pudgy orange. So what is the cause of Pudgy orange? Yes. So you know that it is the most conspicuous sign of breast cancer. This is Pudgy orange. This is the most conspicuous sign of breast cancer, Pudgy orange. This is the most conspicuous sign of breast cancer, and you know what is the cause here? There are subdermal lymphatics. So it is because of obstruction or permeation of subdermal lymphatics by tumor cells. So it is because of lymphatic permeation, of subdermal lymphatics by tumor cells. Subdermal lymphatics by tumor cells. Clear? By tumor cells. Apart from Pudgy orange, you can see here there is an additional point which you can see, and you can see here that this patient is also having what? Nipple retraction. So Pudgy orange, nipple retraction, both of these findings are highly suggestive of what? Breast cancer. So this is Pudgy orange. It is because of lymphatic permeation by tumor cells. It is most conspicuous sign of breast cancer. Now can you tell me, this is a mammography. On the basis of this mammography, guys, tell me what is the diagnosis? What is the diagnosis? Shalu, Ravi Prakash, Rohit Yadav, Shan. Tell me Raghav, Bhanu, what is the diagnosis here guys? Yes. So in this case you can notice that here there is nipple retraction. Apart from nipple retraction, can you see there is opacity, and this opacity is irregular. Apart from this irregular opacity, you can notice that the patient is having what? Microcalcification. So finding there is nipple retraction, you can notice that here there is nipple retraction. Apart from nipple retraction, you are going to notice that there is irregular opacity. Apart from irregular opacity, there is microcalcification. Can you tell me what is the size of calcification? In microcalcification, what is the size of calcification? Mani, Khushi, Rashi, Asila, Ronak, Madhumita. Yes, what is the size in microcalcification? Obviously, the size is less than 0.5. So these findings are suggestive of malignancy or benign disorder. Tell me. Nipple retraction, irregular opacity, microcalcification, these findings are suggestive of carcinoma or it's a benign disorder. Yes, Pankaj, Dr. Shalupriya, Harsh, obviously it's malignancy. So guys, it is suggestive of breast cancer. So this patient is having malignancy, right? Malignancy. Now you can see the second mammography, and on the basis of this mammography, can you tell me what's the finding and what's the diagnosis? Yes, you can see the second one. Guys, see the second one. Here you can notice that there is popcorn calcification. Can you see the popcorn calcification? See the nipple. Nipple is normal. Nipple is normal. There is macro calcification. This is popcorn calcification. Apart from that, you can see the breast appears dense glandular. Why? Because these areas are black. It means the patient is young. What is the diagnosis? Diagnosis: Prachi, Prakhar, Yashti, Alia, Jenil, Yasmin, Bhanu, Shan, Mani. Almost everybody is correct. It is fibroadenoma. So guys, what's the diagnosis here? This is fibroadenoma. It is fibroadenoma, and in this image you can notice that there is macro calcification. What kind of calcification is there? You can see this is popcorn. So what is the name of this calcification, guys? This is popcorn calcification. It is popcorn calcification. And the size, how much is the size? Size is more than 0.5 mm. Size, it is more than 0.5 mm. So this is fibroadenoma. You know that fibroadenoma, it is seen in young females age approximately 15 to 25. It's a benign tumor, right? Highly mobile. So what is the other name of fibroadenoma? It is also known as breast mouse. So it is benign tumor. It is highly mobile. It's also known as breast mouse. So that's breast mouse. Clear? Next, can you tell me what is the name of this technique? Guys, what is the name of this technique? See the image and tell me what is the name of this technique. Ravi Prakash, Gopika, Harsh Arora, Raghav, Shravani, Prakhar. Yes, very good. First person to reply correctly. It is Yasti, Ravi Prakash Ray, Kia, Raghav. It is sentinel lymph node biopsy. So you can see here what? That the surgeon is placing this gamma probe in the axilla to locate sentinel lymph node. What is this gamma probe? And during surgery you can notice that what? Here you can notice that this is the blue color lymph node. What is this lymph node actually? This is sentinel lymph node. So blue color lymph node, sentinel lymph node, and here you can notice surgeon is placing this gamma probe to identify the sentinel lymph node. So actually this is sentinel lymph node biopsy. Can you tell me the indications of sentinel lymph node biopsy? What are the established indications of sentinel lymph node biopsy? In which malignancies we are doing sentinel lymph node biopsy? Guys, tell me. Sentinel lymph node biopsy, established indications. Sentinel lymph node biopsy, established indications. Obviously, it is done in CA breast, it is done in carcinoma penis, it is done in malignant melanoma. Established indications, I am repeating, it is done in CA breast, it is done in CA breast, it is done in carcinoma penis, done in malignant melanoma. These are the three established indications. Can you tell me two more indications? The two new indications which were asked recently in multiple exams. Carcinoma vulva, very good, Shalin and John. Carcinoma vulva. Apart from carcinoma vulva, Sachin, what else? Apart from carcinoma vulva, yes, carcinoma vulva, very good. Apart from carcinoma vulva, what else? What else? Fifth, yes, I am waiting. Guys, Abhishek Pesara Meli, very good Abhishek, you are absolutely correct. Head and neck malignancies. Head and neck malignancies. Head and neck malignancies. Got it? This is one question. Second question, whenever we are performing sentinel lymph node biopsy in the breast, we have two techniques. One is blue dye technique and second is technetium labeled colloid technique or radioactive colloid technique. Can you tell me the name of dye? In blue dye technique, guys, tell me which dye is used. In blue dye technique, which dye is used? Kia, tell me what is the name of dye? Yes, guys, tell me what is the name of dye? It is 1% lymphazurine. The name of this dye is 1% lymphazurine, or we are using isosulfan blue. Isosulfan blue. We can use methylene also, methylene blue also, but it is 1% lymphazurine most commonly, or isosulfan blue. Second, we are using radioactive colloid. Can you tell me the name of colloid? What is radioactive colloid used? Guys, tell me. Colloid. Technetium 99 labeled, technetium 99 labeled sulfur colloid. Technetium 99 labeled sulfur colloid. Sulfur colloid. Sulfur colloid. Easy. Next question for all of you. Can you tell me what is the most common complication of sentinel lymph node biopsy? Tell me. You are going to inject the dye. Where exactly you are going to inject the dye? Around the nipple. It's not in the nipple, around the nipple. Around nipple means approximately around the tumor, and around the nipple means in areola. Clear? So, can you tell me, if you are injecting the dye, what is the most common complication? Very good. First person to reply correctly. First person to reply correctly is Sachin Kumar, Lone Bilal, Prakhar. Guys, it is tattooing. So, most common complication is tattooing because you are injecting the dye. Second question, can you tell me what is the most commonly injured nerve during sentinel lymph node biopsy? Easiest question, guys, tell me. Yes, and somebody already replied, Minhazul Islam. Yes, so most commonly injured nerve, that is intercostobrachial nerve. All these are questions. I am repeating. The most common complication, that is skin tattooing. The most common complication, that is skin tattooing. Got it? It is skin tattooing. And most commonly injured nerve, the most commonly injured nerve, that is intercostobrachial nerve. So, it is intercostobrachial nerve. So, that is intercostobrachial nerve. Intercostobrachial nerve, that is the most commonly injured nerve. So, this is sentinel lymph node biopsy. Okay. Now, see the next question. I am telling you the history, you have to tell me the diagnosis. In this patient, yes, left sided modified radical mastectomy was done. She was having breast cancer. So, for breast cancer, left sided modified radical mastectomy was done. After 6 months of surgery, this patient presents with this condition. Guys, tell me what is the diagnosis? Obviously, so in the left upper limb, you are going to notice that there is lymphedema. So, what is the diagnosis here, guys? The patient is having lymphedema. Lymphedema. Why there is lymphedema? Can anybody tell me? What is the cause of lymphedema? You know, the most common cause overall in lymphedema, what is the most common cause in general? The most common cause of lymphedema worldwide, it is filariasis. What is the second most common cause? Filariasis means lymphatic obstruction. Second, it can occur because of lymphatic disruption. So, whenever you are going to perform modified radical mastectomy, you are going to perform axillary lymph node dissection, and because of axillary lymph node dissection, what will happen? Yes, lymphatic disruption. So, whenever there is lymphatic disruption, it leads to lymphedema. So, what is the cause, guys? It is in the patients of MRM when you perform axillary lymph node dissection, and because of this axillary lymph node dissection, there is lymphatic disruption. So, there is lymphatic disruption. Okay? Clear? Another question I am asking you, suppose in the same patient after modified radical mastectomy, radiotherapy was also given. Clear? And after modified radical mastectomy and radiotherapy, usually after 10.5 years, patient developed one malignancy. After 10.5 years, patient developed angiosarcoma in this left upper limb. Can you tell me what is the name of this syndrome? Guys, tell me. Yes, lymphangiosarcoma. Very good, Twinkle, Mini. Very good. First person to reply correctly, it is Gopika, then Yatinder, then Ravi Prakash. After that, Shalupriya. Guys, it is Stewart-Reeve syndrome. So, after 10.5 years of modified radical mastectomy plus radiotherapy, if patient develops angiosarcoma, and you know this angiosarcoma, it is also known as lymphangiosarcoma. So, angiosarcoma also known as lymphangiosarcoma, and this is known as what? Stewart-Reeve syndrome. What is name? It is also known as Stewart-Reeve syndrome. So, one question for all of you, can you tell me what is the most common complication of mastectomy? Guys, easiest question, tell me. Let me see who is the brilliant student over here, genius over here. Most common complication of mastectomy. Tell me, I am waiting for your reply. Guys, tell me, I am waiting for your reply. Most common complication. Yes, no. Very good. First person to reply correctly, Megha. Second is Gopika. Third is Rohit. Fourth is Shaleen. Fifth is Mini. Guys, it is seroma. This was asked in NEET PG. So, the most common complication of mastectomy, that is seroma. This was asked in NEET PG. Clear? So, this is lymphedema. There is one malignancy which can occur, lymphangiosarcoma, also known as angiosarcoma. Right? Next. Tell me, on the basis of these images, what you can see first? You can see eczematous eruption around the nipple. Can you see here, guys? Eczematous eruption around the nipple. You can see here, it is looking like psoriatic lesion. Can you see here? There is eczematous eruption or psoriatic lesion. What is the diagnosis here? Everybody is correct. Everybody, Twinkle, Vani, Shalu, Rashi, Lone Bilal, Yasmin, everybody is correct. Guys, what is the diagnosis? This is Paget's disease of nipple. So, one question for all of you. In Paget's disease of nipple, which malignancy is hidden? In Paget's disease of nipple, what is the underlying malignancy? Tell me. Underlying malignancy, easiest question guys. What is the underlying malignancy? Naveen, Guver, Ronak, Shinu, Yasti, Kia. What is the underlying malignancy? Yes, underlying malignancy. Tell me, it is invasive ductal cancer or DCIS. So, underlying malignancy, either it is DCIS or there is invasive ductal cancer. Clear guys? So, invasive ductal cancer or DCIS. Invasive ductal cancer or DCIS. Got it? So, one question for all of you. Tell me how to confirm the diagnosis. How to confirm the diagnosis of Paget's disease of nipple. Let me see who is the genius over here. Yes, how to make the diagnosis of Paget's disease of nipple. Let me see who is the genius over here. Irresistible, Divas, Nantha, Shinu, biopsy. Okay, it's not correct. Yes, I want correct answer. It is partially correct. Biopsy is partially correct. Guys, first you have to localize where is the malignancy and then biopsy. No, no, no. Till now nobody replied correctly. Till now nobody replied correctly. I want complete answer. First person to reply correctly, Rohit. Rohit is the first person who replied correctly. First person, Rohit, and only person who replied till now correctly, Rohit. It is mammography, complete mammography plus biopsy. So, guys, how to make the diagnosis? It is complete mammography plus biopsy. It is mammography plus biopsy. So, complete mammography plus biopsy. Remember this, it is mammography plus biopsy, right? So, Aishwarya Srivastava, you are also correct, mammography plus biopsy. Next, what is the treatment? Guys, tell me. If there is underlying malignancy, which treatment should be done in this case? I am again waiting who is going to reply this question correctly. Tell me. Paget's disease of nipple, what's the treatment? Since there is hidden malignancy, underlying malignancy, DCIS, very good, mastectomy. Which mastectomy? First person to reply correctly, Ravi Prakash Ray. Guys, we are going to do simple mastectomy. So, this is Paget's disease of nipple, and what is the treatment here? You know, we are going for simple mastectomy. So, what is the treatment guys? We perform simple mastectomy. So, this is Paget's disease of nipple. Okay. Next, easiest question guys, see both of the breasts, tell me what's the diagnosis. Easiest question. This question was asked this year in INI-CET, last year in FMGE. What's the diagnosis? Very good. Pritesh Singh wants to say that sir, it is abscess. Yatinder wants to say, Zoya, Vani, Sachin, yes, Sheikh, all of them wants to say that sir, this is mastitis carcinomatosa or inflammatory breast cancer. Guys, see here, see the typical color pattern, yes, involvement. Whenever there are inflammatory changes involving the breast skin, and how much breast skin is involved? More than 33%, it is looking like mastitis. It is looking like inflammatory condition. So, all of you know what's the name? This is inflammatory breast cancer. This is inflammatory breast cancer. What is the other name of inflammatory breast cancer? Guys, this is mastitis carcinomatosa. What is the name? This is mastitis carcinomatosa. And this was the question, can you tell me what is the stage? Everybody is correct guys, everybody. Yes, Ambika, Zoya, Haitvi, Karodia, Shinu, everybody is correct. It is T4D. So, the stage is T4D. If it is T4D, it behaves like locally advanced breast cancer. That's why here we go for neoadjuvant chemotherapy plus MRM plus radiotherapy, and you know how much breast skin is involved by inflammatory changes. In this case, you have to remember by inflammatory changes, how much breast skin should be involved? More than 33. So, more than 33% of breast skin should be involved by the inflammatory changes. Easy. Next, here presence of lump is not mandatory. Lump हो भी सकता है, नहीं भी हो सकता. So, presence of lump is not mandatory. One question for all of you. What are those two conditions where presence of lump is not mandatory? Tell me. Yasti, Shinu, Deepak, Kushagra, Kia, Ronak, Dr. Sheikh Shuzad, Divas, ओके दिवास वॉन्ट्स टू आस्क सर T4B और T4D को कैसे सोचना है. देखिए T4B इज प्यूडी ऑरेंज. वह प्यूडी ऑरेंज में रेडनेस नहीं होगा स्किन में. दे विल बी प्यूडी ऑरेंज बट दे वोंट बी रेडनेस. अपार्ट फ्रॉम प्यूडी ऑरेंज इफ देर इज रेडनेस इन द ब्रेस्ट स्किन and there is involvement of more than 1/3 just by looking at the breast. If there is redness, there is briny induration, ऐसा लगे कि एब्सेस जैसा दिख रहा है but it is malignancy, so it is T4D. और अगर only purely orange is there then it is T4B. So can you tell me what are those two conditions where presence of lump is not mandatory? Yes, first person to reply correctly Ravi Prakash Ray. Second Yatinder. Guys, both of you are correct. In inflammatory breast cancer as well as Paget's disease of nipple. In Paget's disease as well as inflammatory breast cancer, presence of lump is not mandatory. So another question, if lump is not there, how will you make the diagnosis? What is the investigation of choice for diagnosis? Easiest question. Here lump is not there. Imagine lump is not there. How will you confirm the diagnosis? Guys, tell me. Obviously biopsy. And Ronak, you are absolutely correct. Minhazul Islam, you are correct. Megha Ahir, all of you are correct, guys. So here investigation of choice for diagnosis, it is skin biopsy. And what is the treatment? You know, it is locally advanced breast cancer, so we go for neoadjuvant chemotherapy plus MRM plus radiotherapy. So it is neoadjuvant chemotherapy plus MRM plus radiotherapy. And you know what is the most malignant breast cancer having worse prognosis? It is this one. So this is most malignant breast cancer having worse prognosis. So guys, you know, this is most malignant breast cancer. So it is most malignant breast cancer having worse prognosis. So it is most malignant breast cancer having worst prognosis. It's having worst prognosis. Clear? So this is inflammatory breast cancer. Very good, guys. Next question, tell me what is the diagnosis here? You can see one breast is massively enlarged having bossylated appearance. Yes, and you know everybody knows the correct answer. Guys, tell me. Here left breast, it is massively enlarged having bossylated appearance. Second one, right breast is massively enlarged having bossylated appearance. It is Phyllodes tumor. Can you tell me, this is cystosarcoma Phyllodes. So this Phyllodes tumor behaves like carcinoma or sarcoma. Easy question. Guys, tell me, this is cystosarcoma Phyllodes. So it behaves like carcinoma or sarcoma. It is written what? Cysto plus what is written? Cysto plus sarcoma. So this tumor behaves like sarcoma. Second, Phyllodes. Phyllodes means leaf-like appearance. All of you know. It is Phyllodes. Phyllodes means leaf-like appearance, guys. Leaf-like appearance. Since it behaves like sarcoma, tell me what is the most common route of spread? There is lymphatic spread, there is hematogenous spread, or both? I am waiting for your reply, guys. Tell me. This is behaving like sarcoma. So there is only lymphatic spread, hematogenous spread, or both spreads are seen. Which kind of spread? Very good. Shalu, Soma Subrapal, Deepak Agrawal, yes, Vani, everybody is correct, guys. Only hematogenous spread. So what? Important point. Since it is cystosarcoma Phyllodes sarcoma, only hematogenous spread. Next question, and you have already replied. If there is hematogenous spread, obviously what is the most common site of metastasis? Guys, you know, lungs. How to make the diagnosis of sarcomas? Biopsy. So in this case also we are going for biopsy. Lymphatic spread is not seen, it means there is no involvement of lymph node. If there is no involvement of lymph node, no need to go for lymph node dissection. Three structures are never involved by this tumor. Can you tell me what are those three structures? Waiting for your reply. Megha, Shalu, Divash, what are these the three structures which are spared, not involved by cystosarcoma Phyllodes? Tell me, guys, waiting for your reply. First person to reply correctly, Hasha Nur Rahman. Very good. He says that sir, skin, nipple and chest wall, these are not involved. So guys, there is no involvement of skin, nipple, chest wall. So there is no involvement of skin, nipple, chest wall. That's why there is no skin fixity, no fixity to chest wall, tumor is mobile over the chest wall, there is no nipple retraction, deviation, ulceration. And all of you know investigation of choice for diagnosis is biopsy. Can you tell me the treatment? What is the treatment? We go for simple mastectomy or we go for MRM? I'm waiting for your reply. Tushar, Rupa, Aishwarya, Srivastav, Nishant. We go for simple mastectomy or we go for MRM? Simple mastectomy or MRM? Very good. If it is benign, go for wide local excision. But if it's malignant, we go for simple mastectomy. Why MRM is not done? Guys, tell me. Only simple mastectomy is done. Why MRM is not done? So, what is MRM? Modified radical mastectomy. It is simple mastectomy plus removal of level 1, level 2 lymph node. There is no involvement of lymph nodes, that is why we are not going for MRM. So, what is sufficient here, guys? The sufficient treatment is simple mastectomy. Simple mastectomy, because you know that in sarcomas there is no involvement of lymph nodes. Got it? So, can you tell me what are those sarcomas in which there is lymphatic spread also? Guys, tell me which sarcomas are having lymphatic spread, and it's very easy to remember, guys. Yes, you know the mnemonic is MARSES. So, the mnemonic is MARSES. These are the sarcomas which are having lymphatic spread. Easy to remember. First, malignant fibrous histiocytoma. Second, A, that is angiosarcoma. Third, R, that is rhabdomyosarcoma. C, this is clear cell sarcoma. E, epithelioid sarcoma. S, that is synovial sarcoma. This is synovial sarcoma. Easy, guys. So, what? Malignant fibrous histiocytoma, angiosarcoma, rhabdomyosarcoma, clear cell sarcoma, epithelioid sarcoma, synovial sarcoma. These are the 6 sarcomas having lymphatic spread. That is why here we go for lymph node dissection. You will remember? Yes, very good. Next. Guys, tell me, this is one of the frequently asked image based question. Can you see here? What's the diagnosis here? Guys, tell me. One of the frequently asked image based question. Guys, tell me what's the diagnosis? Tell me, guys, tell me. Very good. Everybody is correct. Guys. Everybody is correct. So, this is Mondus disease. Yes, Nishant, it's not Monday. Mondus disease. So, what is this Mondus disease? There is superficial thrombophlebitis of inframammary vein. Can you tell me the name of the vein? I am waiting for your reply. This is Mondus disease. Clear? There is superficial thrombophlebitis of inframammary vein. Can you tell me which vein? This one. What is the name of this vein? This is lateral thoracic. And what is this one? Guys, this is thoracoepigastric. So, this is lateral thoracic, this is thoracoepigastric. So, what? Guys, you know, this is lateral thoracic, involvement of which vein? Lateral thoracic. And apart from lateral thoracic, which one? Thoracoepigastric. It is thoracoepigastric. So, lateral thoracic and thoracoepigastric. Right, you know that whenever in vein there is thrombophlebitis, so it feels like a cord, it feels like a string. So, what is the other name of Mondus disease, guys? Other name, you know that it is also known as string phlebitis. What is the other name? This is known as string phlebitis. Clear? So, this is string phlebitis. Easy. So, Mondus disease, one of the frequently asked question in both NEET PG and FMGE. Next, easiest question asked almost every year. Yes, somebody was telling me that, sir, what's the difference between breast abscess and this? Whenever breast abscess image will be there will be clinical description or clinical history that patient is a lactating female, usually within 7 days or 10 days she came to you, there is a fever also, breast is engorged, temperature is raised. So, everybody is correct, this is breast abscess. Guys, tell me which organism is responsible? Breast abscess. Because of faulty breastfeeding technique, it is more common in primaries. If you are going to examine the nipple, these females are having cracked nipple, and because of this cracked nipple, there is one organism from the skin going into the breast. Which organism, guys? All of you know, Staph aureus. So, organism is Staph aureus. Clear? What is the treatment? If you see the latest edition of Bailey, 20th edition of Bailey, it says that just go for ultrasound guided aspiration. No, that's not correct. If you go for Schwartz and Sebastian, in Schwartz and Sebastian it is written that we have to go for IND, because only aspiration, it will lead to antibioma formation. That's why what is the treatment of choice? Treatment of choice is IND plus antibiotics. Guys, remember, the treatment of choice is incision and drainage plus antibiotics. And can you tell me what is the first line antibiotics for Staph aureus? This was asked in NEET PG. First line antibiotics, tell me guys, first line antibiotics, very good, Megha, very good Megha, most of the times you are correct. So, we give cloxacillin or dicloxacillin for 10 to 14 days. So, guys, what we give here, we give cloxacillin, we give cloxacillin or dicloxacillin. So, it is cloxacillin or dicloxacillin and it is given for 10 to 14 days, 10 to 14 days, got it. So, we are giving it for 10 to 14 days. This is breast abscess. Okay. Next, very easy question. Next, easiest question asked almost every year. I am telling you the history. 15 years old boy, he is having a swelling in midline swelling in anterior part of neck. Swelling moves with deglutition. On protrusion of tongue, swelling moves up. Guys, tell me the diagnosis. Swelling moves up on protrusion of tongue. You can see here, swelling moves up on protrusion of tongue. What's the diagnosis? Everybody is correct. Everybody is correct. This is thyroglossal cyst. So, guys, it is congenital or acquired. All of you know this is thyroglossal cyst. It is congenital or acquired. All of you know this is congenital. What is the age of presentation? This is congenital. What is the age of presentation? Age of presentation is 15 to 30 years. Very good. 15 to 30 years. Can you tell me what is the most common type? Who said acquired? Very bad. Divas, very bad. It is congenital, right? So, tell me what is the most common location? Yes, subhyoid or infrahyoid. So, it is subhyoid, right? So, this is subhyoid or infrahyoid. Infrahyoid. Next question. There is one malignancy which can be seen in thyroglossal cyst. Tell me which malignancy. Waiting, Vivek, you are very advanced. In advance only, you are telling me the treatment in advance. Guys, tell me which malignancy in thyroglossal cyst. Very good. Shalin and John, Mohit, Sihag, everybody is correct, guys. It leads to increased risk of papillary carcinoma thyroid, and all of you know what's the treatment. The treatment of choice is cyst trunk operation. You know what's the treatment? The treatment of choice, that is cyst trunk operation. It is cyst trunk operation, and all of you know what we do in cyst trunk operation? En bloc excision of cyst along with central part or body of hyoid. So, this is cyst trunk operation, thyroglossal cyst. Next, first, everything is written. Okay, I am asking the question, guys, tell me. This is hot nodule. Here you can see there is uptake of radioactive iodine mainly in one nodule in comparison to rest of the thyroid. So, this nodule is hot. How much is the risk of malignancy? Tell me. How much is the risk of malignancy in hot nodule? Guys, tell me how much is the risk of malignancy in hot nodule? Kia, first person to reply correctly, 1 to 3%. So, Kia, absolutely correct, it is 1 to 3%. Risk of malignancy in hot nodule 1 to 3%. Here you can see this is the normal thyroid scan. In this normal thyroid scan, you can notice that the areas which are black, there is uptake of radioactive iodine. The areas which are white, there is no uptake. Got it? So, here you can notice that there is one nodule. This nodule is having relatively lesser uptake in comparison to rest of the thyroid. So, lesser uptake in comparison to rest of the thyroid. Guys, which nodule? Cold nodule. So, now comes the question. Megha already replied. Hashanur Rahman already replied. How much is the risk of malignancy? Guys, all of you know, 17 to 20%. Risk of malignancy 17 to 20%. All of you know, cold nodule, it's not going to take radioactive iodine. So, now tell me the treatment. Megha, you tell me, what's the treatment? What's the treatment of cold nodule? If it doesn't take radioactive iodine, obviously we cannot go for radioactive iodine ablation. So, we are left with only one option, remove the nodule. Means in the lobe also where nodule is there, we have to remove the whole lobe. So, guys, what's the treatment? Tell me. Thyroidectomy. Which thyroidectomy? Yes, hemithyroidectomy. So, if there is cold nodule, since relatively there is high risk of malignancy, we go for hemithyroidectomy. Easy? Hemithyroidectomy. And let me tell you, This is a new generation question, guys. Here you can see this cold nodule. We are expecting one question out of radioactive iodine scan, right? So, this is one. This is the second set. If you see the first one here, if you see this thyroid, here almost whole thyroid is having higher uptake, because you can see the both lobes are having, yes, increased uptake, because both lobes are relatively black. So, what is this? This is Graves' disease. What is the problem in Graves? You know, diffuse toxic goiter. So, you can notice that diffusely there is increased uptake. So, guys, this is diffuse toxic goiter. What is this? This is diffuse toxic goiter. This is diffuse toxic goiter. Okay. You can see the next picture. In the next picture, you can notice that what? Here, can you see? This is one nodule, two nodules, 3, 4, 5. There are 5 black nodules, and you can see here there are 2 relatively white nodules. So, this is multinodular goiter. Which one is more, white or black? Black. It means there is increased uptake. So, these are actually toxic. There is increased uptake. So, what is the name, guys? This is toxic multinodular goiter. Toxic multinodular goiter. One question for all of you. If a patient is having toxic multinodular goiter, what is the treatment of choice? Tell me. Hemithyroidectomy, total thyroidectomy, subtotal thyroidectomy. It's a question for all of you. Guys, tell me. It is toxic multinodular goiter. What's the treatment? Hemithyroidectomy, total thyroidectomy, subtotal thyroidectomy. Yes, majority of you are correct. We go for total thyroidectomy. Total. Why we prefer total thyroidectomy? Because we want to remove the whole thyroid. Even if you are going to leave little amount of thyroid, what will happen? After 20 years, after 30 years, there are high risk of recurrence. So, it's better go for total thyroidectomy. So, in which case we go for hemithyroidectomy if patient is having multinodular goiter? The patient in whom after 20 years, after 30 years, there is no recurrence. Can you tell me which patient? Guys, I am waiting. If there is no recurrence after 20 years or 30 years, in that case you can go for, yes, you can go for subtotal thyroidectomy. Obviously, elderly. Souvik Ghosh, very good. Souvik Ghosh, yes. So, multinodular goiter in elderly. Multinodular goiter in elderly. Here we go for subtotal thyroidectomy. Easy. Next. Can you see this picture? Hardly you can see any uptake. Why? Because it is thyroiditis. What is this? Inflammation. So, because of this inflammation, there is follicle destruction, and since there is follicle destruction, what is the big problem? There is hardly any uptake. So, here the radioactive iodine uptake, it is less than 5%. So, when there is radioactive iodine uptake, you can see, guys, it is less than 5%. This is thyroiditis. Let me tell you, this is one of the potential question which will be asked in exams. Okay. So, this is thyroid scan or radioactive iodine scan, image based questions. Okay, guys, now see the next question. Easy question. Can you see exophthalmos? Can you see this patient is having pretibial myxedema? So, protrusion of eyeball, exophthalmos, pretibial myxedema because of deposition of glycosaminoglycans. Tell me, guys, what's the diagnosis? All of you are correct. It's Graves. It's Graves. Graves disease. So, you know that Graves disease is an autoimmune disorder. If it's an autoimmune disorder, can you tell me the autoantibody name? What's the name of autoantibody? Yes. What's the name of autoantibody? Guys, tell me what's the name of autoantibody? First person to reply correctly, Megha. Second is Nidhi. Third is Alia. Guys, it is LATS. What is LATS? The students who are not going to study properly, especially in their childhood, they also get LATS from the parents. LATS, got it? So, LATS is long acting thyroid stimulator. This is long acting thyroid stimulator. So, this is long acting thyroid stimulator. Since it is long acting thyroid stimulator, can you tell me it is acting against which receptor? Okay, so Priya understood it. Some of you also got the LATS during your childhood, especially from your father. Yes. So, guys, this is against which receptor? It is against TSH receptor. So, this is against TSH receptor, and if TSH receptor is stimulated, obviously what will happen? Yes, there is increased T3, increased T4, and because of that there is feedback inhibition of TSH. So, decrease TSH. This was the question in NEET PG last year. So, this is Graves' disease. Here the patients will be having hyperthyroidism, signs and symptoms of hyperthyroidism, and you know, whenever there is hyperthyroidism, there is increased expression of beta receptors. So, these patients will be having signs and symptoms of thyroid stimulation, sympathetic stimulation. So, patient will be having tachycardia, palpitation, and patient will be having tremors. Can you tell me what kind of tremors? Fine tremors or coarse tremors? Guys, tell me. What kind of tremors? Fine tremors or coarse? Yes, guys, tell me, fine tremors or coarse tremors? Yes, Megha, Shalu, very good, fine tremors. I told you already the answer. Where are you going to see the tremors? Tell me. Where we are going to find the tremors? Tell me. So, tremors. Ashi, very good. Tell me, where you are going to find the tremors? Tremors, obviously fingers. Where else? Tongue. So, we are going to find the tremors in fingers and tongue. Fingers and tongue. Fingers and tongue. Right? Next, there are multiple questions which are asked in relation to anti-thyroid drugs. What are those anti-thyroid drugs which are given in these patients? We can give methimazole, carbimazole, propylthiouracil, and you know that anti-thyroid drug of choice in pregnancy, if nothing is mentioned, it is carbimazole. If trimester is mentioned, in first trimester, it is propylthiouracil. In second and third trimester, it is carbimazole. And treatment of choice, obviously remove the thyroid, we go for total thyroidectomy. And guys, you know that any patient who is unfit for surgery, patient who cannot tolerate the surgery, in that case we go for radioactive iodine ablation. Got it? So, this is Graves. Next, see, this patient is having abscess and the surgeon is performing aspiration. Can you see the color? This is reddish brown or chocolatey brown, chocolate brown or reddish brown. What is the name of this appearance? Anchovy sauce. Can you tell me what is the diagnosis? Yes. What is the diagnosis, guys? Which kind of liver abscess is this? This is amoebic liver abscess. All of you know it is amoebic. You know, this is amoebic liver abscess. And you know the organism responsible for amoebic liver abscess. All of you know the organism responsible. Yes. Amoeba. Which amoeba? Tell me. Amoeba. It is Ent amoeba histolytica. So, what is the name of organism? It is Ent amoeba histolytica, and all of you know that histolytica, it is going to cause histolysis of hepatocytes. There is necrosis of WBCs. So, there is necrosed material, reddish brown or chocolate brown. This is Anchovy sauce appearance, amoebic liver abscess. How to make the diagnosis? You know that here the diagnosis is confirmed by serology. Diagnosis is confirmed by serology, because our body is going to form antibodies, we are going to detect those antibodies. Next, what is the treatment of choice? Easiest question, guys, tell me what is the treatment of choice? Metronidazole, it is high dose oral metronidazole. So, it is high dose, clear? So, this is high dose oral metronidazole. High dose oral metronidazole, metronidazole. And how much is the dose, guys? Can you tell me? It is 750 mg TDS for 10 to 14 days. So, the dose is 750 mg TDS for 10 to 14 days. In majority of cases, we are not going for aspiration. We are not going for aspiration. This is amoebic liver abscess, in which cases we have to go for aspiration if frank pus is there, and that is pyogenic liver abscess. Got it? So, this is amoebic liver abscess. Clear? Next, tell me the diagnosis. These are the three images. On the basis of these three images, guys, tell me the diagnosis. Tell me. Mash, Megha, very good, Megha, Reet, Shalupriya, Prachi, all of you are correct, guys. First, you can see this. In the liver, you can see these multiple cysts. Can you see here? These are the multiple cysts. Whatever is the problem, you can visualize the problem on CT or ultrasound. On the ultrasound, what you can see, cyst within cyst appearance, this is known as rosette appearance. There is cyst within cyst appearance, this is known as rosette appearance. Rosette appearance, and here on the CT also you can see multiple cysts in the liver. So, this is hydatid cyst, and all of you know in hydatid cyst, what is the organism responsible? You know the guys organism, all of you know the answer. Most commonly it is Echinococcus granulosus. Clear? So, this is Echinococcus granulosus. If patient is having multiple cysts in multiple organs, it looks like malignancy. that is known as malignant hydatidosis. So, which organism is responsible for malignant hydatidosis? Tell me. I am waiting for your reply. Multiple cyst in multiple organs, looks like malignancy, name malignant hydatidosis. I told you the answer also. So, it is multilocularis. So, malignant hydatidosis, it is caused by Echinococcus multilocularis. So, it is because of Echinococcus multilocularis. Okay guys, multilocularis. Can you see here? Typically this question was asked multiple times. It is a potential question. What is this? All of you know. What is this? Tell me. So, guys, this is water lily. So, what is the name? This is water lily sign. All of you know that this is water lily sign. Water lily sign. Here you can notice that there is ring like calcification. Can you see here guys? There is ring like calcification on CT, and this ring like calcification again it is seen in hydatid cyst. So, what is this? This is ring like calcification. Clear guys? So, this is ring like calcification. This is seen in hydatid cyst. So, I am telling you on ultrasound there is cyst within cyst appearance, also known as rosette appearance. On CT there is ring like calcification, it is seen in hydatid cyst. Okay, very good, clear. So, next question guys, next tell me what is the diagnosis. Let me see who is the genius over here. Tell me guys, cut section of tumor has been given, CT of the tumor has been given, you can see the CT and then tell me, can you see the CT? Let me mark the tumor, you can see this is the tumor, clear. So, this is the CT, this is the tumor and cut section of tumor is also there. Guys, tell me what is the diagnosis. Very good, everybody is marking correct answer. It is FNH, focal nodular hypoplasia. Question for all of you, it is a benign tumor or malignant tumor? Focal nodular hypoplasia, it is a benign tumor or malignant tumor? So, it is the second most common benign tumor of the liver. Can you tell me what is the most common benign tumor of liver? Easiest question, what is the most common benign tumor of liver? Hemangioma, and this is second most common. This is second most common benign tumor. Okay. So, next question guys, you can see here, see the tumor. In this tumor you can notice that this kind of scar is there. Can you tell me what is the name of this scar? On CT also you are going to find this scar. What is the name? Name of this scar? Guys, tell me what is the name of this scar? Yes, Kia, very good Kia, it is central stellate scar. Tell me what is the name? This is central stellate scar. Apart from central stellate scar on CCT, if you do angiography, on angiography this kind of typical appearance will be there. See and tell me. On angiography this kind of typical appearance is there. Guys, tell me what is the name? Easiest question, what is the name of this appearance? Tell me. This is cartwheel or spoke wheel appearance. So, on which investigation you are going to find it? It is seen on angiography. So, what is the name guys? Name. This is cartwheel or spoke wheel appearance. So, the name, this is cartwheel or spoke wheel appearance, clear. So, this is cartwheel or spoke wheel appearance. So, cartwheel or spoke wheel appearance, clear. So, central stellate scar on CCT, cartwheel or spoke wheel appearance on angiography, it is typically seen in FNH. What is the name? Focal nodular hypoplasia. Okay. Next, tell me the diagnosis here. See this image and tell me. Guys, easiest question. See this image and tell me the diagnosis. This is triple phase CT. On triple phase CT, during arterial phase you can see this tumor. During venous phase you can see this tumor. So, during arterial phase, can you see here? There is arterial hypervascularization. During venous phase you can see venous washout of contrast. So, there is arterial hypervascularization with venous washout. This is the diagnostic criteria of HCC and everybody is correct. Everybody is correct. So, guys, this is hepatocellular carcinoma. During arterial phase you can notice that there is arterial hypervascularization. This is arterial hypervascularization, got it? And during venous phase there is venous washout. arterial hypervascularization with venous washout. Venous washout. This is the diagnostic criteria of HCC. HCC. Okay. Next. One by one you have to tell me the answer. This is first image. This is the second image. Okay. Let me explain the first one. Can you tell me? One is PSRS, one is DSRS. What is PSRS? Proximal splenorenal shunt. What is DSRS? Distal splenorenal shunt. Guys, tell me, what is the first one? What is the second one? First one. First, you can see here, this is splenic vein. Got it? What I am going to do? I am going to divide this proximal part of splenic vein and I am going to attach it where? Can you see here? I am going to attach it to the renal vein. So, this is what PSRS, proximal splenorenal shunt. Who made it for the first time? It is also known as Linton's. So, this is Linton's shunt, PSRS or Linton shunt. You have to perform splenectomy and then only you can perform PSRS. In this image you can notice the distal part of this splenic vein is anastomosed to renal vein. So, guys, what is the name? This is DSRS. Who made this DSRS for the first time? Warren. So, this is also known as Warren shunt. Yes, what is the name? Warren shunt. Got it? So, first is PSRS, proximal splenorenal shunt. Second is DSRS, that is distal splenorenal shunt. Right? How to remember what is proximal, what is distal? कोई भी structure जहाँ से start होता है, that is proximal. You can see the splenic vein is going to start from here. This is proximal. It ends here. Distal. याद करने का आसान तरीका क्या है? Proximal मतलब पास, distal मतलब दूर. तो जो पास है that's proximal, जो दूर है that is distal. Got it? So proximal, distal. Proximal, distal. Okay. So first PSRS, second DSRS. Next. Easiest question, it was asked multiple times. Tell me what's the name of this tube. Guys, tell me. Yes, Megha, pass, जो pass है proximal, जो दूर है distal. ठीक है, याद रहेगा. Next, tell me what's the name of this tube. You can notice easily that there are 1, 2, 3. 1, 2, 3. Triple lumen. How many balloons are there? 1 and 2. Triple lumen, double balloon triple lumen tube, all of you know, this is known as Singh-Steken-Blakemore tube, SB tube. So, guys, what's the name? This is Singh-Steken-Blakemore tube. Clear? So, this is Singh-Steken-Blakemore tube. So, this is SB tube, also known as Singh-Steken-Blakemore tube. Singh-Steken-Blakemore tube. So, this is double balloon triple lumen tube. Double balloon triple lumen tube. What is the role? What do you do basically? Here you are going to insert this and after that you inflate the balloon. When the balloon is inflated, it is going to control the bleeding by pressure effect, that is known as tamponade effect. So, whenever in emergency endoscopic facility is not available or failed, you have to control the bleeding, or during transportation what? We are using this Singh-Steken-Blakemore tube. So, one easy question for all of you. Tell me what is the most common complication of insertion? Waiting for your reply. Manak, Ghosh, Mash, Jyoti, Ravi Prakash, Prakhar. Tell me, what is the most common complication of insertion? Megha, very good Megha. Rupa, very good Rupa. Megha, both of you are correct. It is aspiration. That's why what should be protected? Before insertion, airway should be protected. So, what? Airway should be protected. So, the airway should be protected. Airway should be protected. Clear? So, airway should be protected because the most common complication is aspiration. So, the most common complication is aspiration. Clear? So, guys, this is Singh-Steken-Blakemore tube. Okay. Next. See this image and tell me. Yes, tell me, guys, what is the name of this appearance? You can see here. Yes, this is your dream car sign. Guys, can you see here? Your dream car. So, can you tell me what is your dream car? Yes, this is your dream car sign. Very good Jyoti, very good Jyoti. Deepak, Ravi Prakash, Ray, everybody is correct. Guys, this is Mercedes-Benz sign. So, you can see here trifold, you can see here tri-radiate fissure. Can you see this? This is tri-radiate fissure. You can notice that tri-radiate fissure, this is known as Mercedes-Benz sign. So, Mercedes-Benz sign, Mercedes-Benz sign. This is because of this tri-radiate fissure, that is Mercedes-Benz sign. So, another question guys, if there is bi-radiate fissure, see this and tell me, if this kind of bi-radiate fissure is there, this is bi-radiate fissure, what is the name of this sign? Yes, it is seen in gallstone, everybody is correct. Tausif, you are correct absolutely. Dr. J, Abdul Khalik, Ronak, seagull sign. So, if it is biradiate fissure, seagull sign, biradiate, triradiate fissure, that is Mercedes-Benz sign. Okay. Next question. This was asked multiple times in multiple exams. First see, what is the name of the scan guys? See this. On this scan you can see the radio tracer, it is taken by the liver first. After that, it is going into the CBD, it is going into the bladder, it is entering into duodenum, then small intestine. Can you tell me guys, what is the name of this scan? Everybody is correct. HIDA. HIDA. Can you tell me what is the full form of HIDA scan? Waiting for your reply. HIDA scan. Guys, what is the full form? HIDA scan. Full form? Yes. Hepatobiliary immunodiacetic acid scan. Hepatobiliary immunodiacetic acid scan. You know that this is the gold standard investigation for diagnosis of acute cholecystitis. Can you tell me the investigation of choice for diagnosis of acute cholecystitis? Guys, what is the investigation of choice for diagnosis of acute cholecystitis? Investigation of choice I am asking. Yes, Sanya, very good. Deepak, Mash, Manak, Shweta, everybody is correct. Guys, you know, the investigation of choice for diagnosis in cases of acute cholecystitis, it is ultrasound, but the gold standard is HIDA. What is the initiating event in acute cholecystitis? Everybody knows what? That there is cystic duct obstruction, and if there is cystic duct obstruction, what is the diagnostic criteria? Can you see here? The diagnostic criteria of acute cholecystitis. Can you see? The diagnostic criteria of acute cholecystitis, that is non-visualization of gallbladder or non-filling of gallbladder. So, this is the diagnostic criteria. So, this is non-visualization guys. So, it is non-visualization or non-filling of gallbladder. This is the diagnostic criteria on HIDA scan. Clear? So, this is acute cholecystitis. Next, ultrasound, tell me the diagnosis. What you can see, what is the name of this sign? Deepak, don't worry, we will share the PDF. Comet tail artifacts, very good. Megha, diamond ring sign. Mash, it is not Phrygian cap. Yes, rest everybody is correct. It is diamond ring. Comet tail artifacts or V-shaped artifacts. What is the name of this condition guys? It is adenomyomatosis. This is adenomyomatosis. Clear? So, this is diamond ring sign. On ultrasound you can see here, there is diamond ring sign, also known as comet tail artifacts. So, comet tail artifacts, also known as V-shaped artifacts. You can see here V-shaped artifacts, So, here what is the problem? There is deposition of cholesterol crystal in Rokitansky of sinuses. When you perform ultrasound, it looks like diamond ring, comet tail artifacts or V-shaped artifacts. Diagnosis, adenomyomatosis. Next, easiest question, guys, tell me what is the name? All of you know. Yes, here this is the gallbladder and here this is the strawberry. Gallbladder is looking like strawberry. What is the name? All of you know, strawberry gallbladder. Can you tell me what is the other name of strawberry gallbladder? Strawberry gallbladder. Tell me guys. Strawberry gallbladder. It is cholesterolosis. So, it is very easy to remember. It is because of deposition of what? Cholesterol. Cholesterol ka kya? Can you tell me? Cholesterol ka kya? Cholesterol ester. So, it is caused by deposition of cholesterol ester. This is acquired condition, this is benign condition. So, one thing you have to remember, everything related to strawberry gallbladder, yes, that is related to cholesterol. So, can you tell me this person is suffering from one disease, which one? Guys, tell me, Priya, Prakhar, this person is suffering from one disease, can you tell me the name? Which disease? Related to cholesterol, hypercholesterolemia, very good. Second, which gallstone will be there inside? Which type of gallstone will be there inside? Tell me. Cholesterol gallstone. Tell me which kind of polyp will be there in the gallbladder? Cholesterol. So, everything is related to cholesterol. Patient is having increased cholesterol in the body. So, cholesterol is increased in the body, hypercholesterolemia. Which type of stone is there? Cholesterol gallstone. Which type of polyp is there? Cholesterol polyp. Easy. What is the treatment? If patient is having symptomatic gallstone, we go for lap cholecystectomy. So, what is the treatment, guys? Lap cholecystectomy. Okay. Who is telling cholesterol oxalate? Mudassir? Very bad. Tell me which stone is there? What is the composition of cholesterol gallstone? Question for all of you. Let me see who is the genius over here. What is the composition of cholesterol gallstone? Mudassir has written cholesterol oxalate. Tell me, guys. I'm waiting. Let me see who is the first person to reply. What is the composition of cholesterol gallstone? Tell me, guys. No, nobody replied correctly till now. I'm waiting. Nobody. Very good. First person to reply correctly, Megha. Very good, Megha. Second person is Ravi Prakash Ray. It is crystalline cholesterol monohydrate. And actually, this was asked in NEET PG. Guys, what is the composition of cholesterol gallstone? It is crystalline cholesterol monohydrate. So, this is crystalline cholesterol monohydrate. Clear? So, this is crystalline cholesterol monohydrate. Okay? Clear? So, this is strawberry gallbladder, right? Next question. Tell me, this was asked in NEET PG. Here you can notice there is some growth. Clear? And here you can notice on ultrasound this kind of growth. What is this? Tell me. This is polyp. Okay? If you see the ultrasound, it is a small polyp, but if you see the gross specimen, it is looking like malignant. So, guys, this is gallbladder polyp. How to differentiate polyp from stone on ultrasound? If polyp is there, there is no posterior caustic shadowing, but if stone is there, in the stone you are going to notice posterior caustic shadow. So, whenever the stone is there, posterior caustic shadowing will be there. If the polyp is there, there is no posterior caustic shadowing. So, what's the diagnosis here? This is gallbladder polyp. Gallbladder polyp. Next, guys, tell me what's the diagnosis? Waiting for your reply. Easiest question. What's the diagnosis here? Okay, what you can see? You can see this organ and you can see this organ, right? On X-ray you can see something, on CT you can see something. So, what you can see? Gallbladder is calcified. This is calcified gallbladder. What is the other name? This is porcelain gallbladder. This is calcified gallbladder or porcelain gallbladder. Let me tell you guys, majority of patients are asymptomatic, diagnosed incidentally on X-ray or CT. What is the biggest problem? There is increased risk of invasive cancer. How much is the risk? There is 6% risk of invasive cancer. So, there is the risk of invasive cancer. How much? 6%. That is why, can you tell me the treatment? This is porcelain gallbladder or calcified gallbladder. What is the treatment? Yes, 6% risk. It is not 10. Initially, it was 10. Now, it is 6%. So, we have to go for early lap cholecystectomy. As early as possible, remove the gallbladder, guys. So, we go for early. What we do? Early lap chole. Early lap cholecystectomy is done. Clear? So, this is early lap cholecystectomy which is done. Porcelain gallbladder. Next. Let me see who is the genius over here. This is a CET. And tell me, what's the diagnosis? This is CET. What's the diagnosis? Waiting for your reply, guys. Tell me. Nobody replied till yet. First person is Priya. Second person is Shweta. Third person is Lone Bilal. Fourth is Lubna Kausar. Fifth is Kia. Guys, it is, can you see here? You can notice that this is the dot in the center. Can you see here? There is whitish dot in the center. So, there is whitish dot in the center. So, whitish dot in the center. What's the name? Central dot sign. In which condition central dot sign is seen? Caroli's disease. What is this type of choledochal cyst, guys? This is Caroli's. Caroli's disease. Caroli's disease. And you know, in Caroli's disease, what's the name? This is known as central dot sign. This is central dot. So, this is central dot sign. Caroli's disease. What is this type of choledochal cyst? It is type 5. type 5. So, can you tell me what is the most common type of choledochal cyst? Yes, guys, tell me what is the most common type of choledochal cyst? Most common type? Manak, very bad. It's not type 5. Let me tell you the simple logic. Any classification which starts from 1, 2, 3, 4, 5, usually the most common type is 1. If a classification starts from A, B, C, D, E, usually it's A. Got it? So, if a classification, mostly it's applicable to most of the classifications. Classification which starts from 1, 2, 3, 4, 5, the most common type is type 1. And if classification which starts with A, B, C, D, E, most common type is A. So, in type 1 choledochal cyst, it is 1A, 1B, 1C. Guys, tell me which one is most common? 1A, 1B, 1C. Which one is most common? Easiest? 1A. 1A is most common, right? So, how to remember which type of choledochal cyst is most common? This is type 1. Most common is type 1, followed by type 4, followed by type 3. So, the most common type is type 1, followed by type 4, followed by type 3. So, how to remember? It is 1, 4, 3. 1, 4, 3, guys, you must be knowing the meaning of 1, 4, 3. Can you tell me the meaning? 1, 4, 3. We are supposed to send this message to one person only before midnight. और जिसका कोई नहीं होता वो क्या करता है? Send to all. Waiting for the reply, किसी का reply नहीं आता. Right? So, it is 1, 4, 3. Okay? 1, 4, 3. So, you will not forget now. 1 followed by 4 followed by 3. Clear? So, this is choledochal cyst. Very important. We are expecting a question from choledochal cyst in upcoming exam. Next. Guys, tell me which one is MRCP, which one is ERCP? This is 1, this is 2. Easiest question. 1, 2. Which one is MRCP? Which one is ERCP? Yes, first one is MRCP, very good. Second is ERCP. How to identify? You can see this endoscope. So, this is endoscopic retrograde cholangiopancreatography. This is ERCP. MRCP, magnetic resonance cholangiopancreatography. And for CBD stone, which one is investigation of choice? You know that MRCP is having better sensitivity. This is the investigation of choice. ERCP, it is diagnostic, it is therapeutic. Since it is both diagnostic and therapeutic, this is gold standard. Gold standard, you can easily see the stone. Can you see? This is 1, 2, 3. Easily you can see the stones. Here you can see these are the multiple stones, and the stones are there in the CBD. Stones are there in the cystic duct also. So, in the CBD as well as cystic duct, both you are going to see the stone. So, guys, let me tell you, any problem is there inside the duct, bile duct, any problem is inside the bile duct, like CBD stone, choledochal cyst, biliary stricture, cholangiocarcinoma, primary sclerosing cholangitis stricture. In all these cases, investigation of choice for diagnosis will be MRCP. Clear? So, the investigation of choice will be MRCP if the problem is within the lumen, and if you can remove the stone, you can put a stent for strictures, then the gold standard investigation will be ERCP. Got it? So, this is CBD stone, investigation of choice MRCP, gold standard ERCP. Next, it is a patient of severe acute pancreatitis, SAP. The patient is having hemorrhagic pancreatitis, there is hemorrhage. Patient is having retroperitoneal hemorrhage. Because of this, is easiest question, all of you know the answer. So, because of this hemorrhage, you can see here there is ecchymosis around umbilicus. What's the name? Cullen sign. You can see here there is ecchymosis around the flank. What is the name of this sign? Gray Turner sign. And you can see ecchymosis around inguinal region. Ecchymosis around inguinal region. What's the name? Fox sign. Ecchymosis around inguinal region, the name is Fox sign. Fox sign. Okay. So, it is seen in severe acute pancreatitis. There is bleeding along the facial planes, and you are going to find all these kind of ecchymosis. Very, very important, especially in FMGE. This question was asked, right? Next, guys, again, it's a patient of acute pancreatitis. Can you tell me the name of this sign? Easiest question. On this X-ray, what's the name of this sign? Everything is written. Very good. Chetna, absolutely correct. Chetna, Dr. Rafa, very good. Dr. Balaji, Depoxitin, very good. Shan, everybody is correct. It is colon cutoff sign. You can see this is the stomach. This is C colon. Beyond this yellow arrowheads, you can't see the colon. So, it is colon cutoff. What's the name, guys? Name of this sign, it is colon cutoff sign. Colon cutoff sign, and you know that it is seen in acute pancreatitis. So, in acute pancreatitis there is sentinel loop, there is gasless abdomen, ground glass appearance, colon cutoff sign. So, this is colon cutoff, clear? Colon cutoff. Next, again it is a patient of acute pancreatitis. After 4 weeks of acute pancreatitis, CE-CT was done. This is the image given. What is the diagnosis? Tell me. Guys, tell me the diagnosis. Easiest question. First person to reply Ronak, second is Dr. Rafa, third is Raghav, fourth is Vitarayan, Depoxetine, Shweta. Everybody is correct. Can you see here? This is the cystic lesion in the lesser sac. Just behind the stomach, this is the cystic lesion. So, guys, this is pseudocyst. Pancreatic pseudocyst. Pseudocyst. It is pseudo means it is false. It is not lined by epithelium. So, it is false cyst because it is not lined by epithelium. False cyst. What is the most common location? All of you know, lesser sac. Can anybody tell me what is the most common cause? The most common, let me tell you, most common cause of acute pancreatitis, it is gallstone followed by alcohol. So, can you tell me what is the most common cause of pseudocyst, gallstone or alcohol? Waiting for your reply. Kia, Ronak, Likhita, very good Likhita, nice name. Megha Ahir, yes guys, it is alcohol. Let me tell you, gallstone is not going to cause permanent changes in the pancreas. The permanent changes are mainly caused by alcohol. So, here what is the most common cause? Remember, most common cause is alcohol. Pseudocyst, most common cause alcohol. It is pseudo false cyst. In majority of cases is resolved spontaneously. Whenever it is going to persist for more than 6 weeks or the size of cyst is more than equal to 6 centimeter, in that case we go for treatment. Cystogastrostomy, cystoduodenostomy, cystojejunostomy. Which one is treatment of choice? You know, cystogastrostomy, cystoduodenostomy, cystojejunostomy. If you have to choose one, which one is having better results? It is cystojejunostomy. Which one is most popular? Cystogastrostomy. So, most popular cystogastrostomy, best results cystojejunostomy. Okay. Next, guys, again it is a case of pancreatitis. Can you see the pattern of calcification? Now, tell me the diagnosis. Can you see the pattern of calcification? Yes, tell me the diagnosis. Chronic pancreatitis, and you know that chronic pancreatitis, it is characterized by a triad. You can see the calcification. Chronic pancreatitis, it is characterized by a triad. How to remember this triad? Mnemonic is DPS. So, chronic pancreatitis, it is characterized by a triad, name is DPS. DPS, D diabetes mellitus, P pancreatic calcification, S steatorrhea. So, guys, it is diabetes mellitus, P pancreatic calcification, S steatorrhea, S steatorrhea. So, what happens in pancreatic chronic pancreatitis? There is exocrine insufficiency, there is endocrine insufficiency, there are permanent changes in the pancreas. So, this is pancreatic calcification, and let me tell you, examiners are not asking CT because on CT is clearly visible. Examiners are mainly asking this X-ray. So, on X-ray you are going to notice that calcification starting from epigastrium and it is going towards the left side. So, this is chronic pancreatitis. Okay. Next, these are the other findings of chronic pancreatitis on ERCP. Can you tell me, guys, what are the names of these appearances? Everything is written. This is chain of flakes appearance, string of pearls appearance, beaded appearance. So, can you see beaded appearance? This is beaded appearance, right? Chain of flakes appearance. So, beaded appearance, chain of flakes appearance, string of pearls appearance, string of pearls appearance, string of pearls. So, what is the problem? You are going to notice the changes in the duct. What are the changes in the duct? Stricture. There is stone. So, one question for all of you. Let me see who is the genius over here. What is the investigation of choice for diagnosis of chronic pancreatitis? Tell me. Waiting for your reply, guys. Investigation of choice for diagnosis. Megha, they have other X-rays also. Tell me, what is the investigation of choice? First person, Lone Bilal, Likhita, Chetna, Priya. Guys, it is MRCP because MRCP is having better sensitivity than ERCP. ERCP is diagnostic and therapeutic, that is why ERCP is gold standard, but investigation of choice is MRCP. So, remember one thing, that in chronic pancreatitis, investigation of choice for diagnosis, it is MRCP, and the gold standard, that is ERCP. Why ERCP is gold standard? Because you know that this is diagnostic and therapeutic. So, this is diagnostic and therapeutic, that is why it is gold standard, that is why it is gold standard. Clear? Next, tell me what is the diagnosis here? This is the barium study. Can you see the arrow? What is the diagnosis here, guys? Yes, let me tell you the hint. There is a mass. Because of mass in the pancreatic head, can you see here? Because there is mass in the pancreatic head, what is the problem? Yes, it is going to cause indentation of antrum of stomach. So, there is indentation of the antrum of stomach. Can you tell me what is the name? Chetna, you are absolutely correct. Chetna. Neeraj, Bind, absolutely correct. This is antral pad sign. So, guys, what is the name? This is antral pad. Clear? So, this is antral pad sign. Name? This is antral pad sign seen in carcinoma head of pancreas. Got it? Antral pad sign seen in carcinoma head of pancreas. Clear? Next, you can see this one. Easiest. Can you see? Tell me what is the name? Guys, tell me the name. Tell me the name. Manik, Minhas, Chetna, first person to reply correctly. Very good. Prakhar, it is not claw, it is reverse 3. Gautam Rao, Dr. Balaji, Ronak, everybody is correct, guys. It is reverse 3. Again, where is the malignancy? Malignancy is here in the head. Because of malignancy in the head, the inflammatory changes are mainly seen over the lateral wall of duodenum. So, this is reverse 3 sign of Frostbug. What is the name, guys? Name? This is reverse 3 sign of Frostbug. Frostbug. And again, it is seen in carcinoma head of pancreas. Reverse 3 sign of Frostbug seen in carcinoma head of pancreas. Got it? Now, see the next one. Here, this is pancreatic duct, this is bile duct. Both of these should join, but what is the problem? There is malignancy over here. Because of that, you can't see the confluence. So, you can see 2 ducts which are separate. Here, you can notice that this is pancreatic duct and you can see this is bile duct. So, pancreatic duct, bile duct, 2 ducts can be visualized separately. So, obviously, what is the name? Double duct. This is double duct sign. So, this is double duct sign, and double duct sign seen in again carcinoma head of pancreas. So, carcinoma head of pancreas, get this into your head, because in exam you forget the head. Got it? So, I am repeating 3, antral pad sign, reverse 3 sign of Frostbug, widening of C loop of duodenum as well as double duct sign. All these are seen in carcinoma head. What? Carcinoma head of pancreas. Okay. Next, guys, tell me the name of this triangle. Easiest question. Easiest question. What is the name of this triangle? And everybody is correct, guys. Everybody is correct. This is gastrinoma triangle. This is gastrinoma triangle. It is also known as triangle of Passaro. This is also known as triangle of Passaro. So, triangle of Passaro. Can you tell me the boundaries? You can notice here, this is cystic duct CBD junction. Cystic duct CBD junction. Here you can see this is body and neck of pancreas, and here you can see this is D2, D3. Second and third part of duodenum. So, that is D2, D3. So, cystic duct CBD junction, body and neck of pancreas, D2 and D3. This is triangle of Passaro. What percentage of gastrinomas are located in triangle of Passaro? All of you know, 90%. So, this is gastrinoma. Next question for all of you. What is the most common site of gastrinoma? Guys, tell me, easiest question, most common site of gastrinoma. Tell me, it is duodenum or pancreas? Yes, guys, most common site is duodenum. So, most common site is duodenum. It is duodenum followed by pancreas. Next, in duodenum, which part of duodenum? In duodenum, it is D1 followed by D2 followed by D3, not seen in D4. So, the most common site is first part of duodenum. Remember, It is associated with Men's syndrome, and Men's syndrome also most common site is D1, first part of duodenum. Remember this. So, this is Zollinger-Ellison syndrome, also known as gastrinoma. Most common site is D1. Next, tell me what is the answer here. Waiting for your reply. Guys, I am waiting for your reply. Megha, very good Megha. Megha, absolutely correct. Manak Ghosh, absolutely correct. This is cystic lesion. In this cystic lesion, can you see this? First see this appearance. Here what you can notice that, these are small cysts. These are microcystic looking like sponge, right? Microcystic looking like sponge. The content is serous. Actually, this is serous cystic neoplasm, and in the center there is central stellate scar, right? When you go for CCT, this kind of calcification is there. This is known as central sunburst calcification. Can you see this? There is central sunburst calcification or central stellate scar, and this is the most common cystic neoplasm of pancreas. What is the most common cystic neoplasm? Serous cystic neoplasm, also known as serous cyst adenoma. So, guys, I am repeating all the questions. This is very important. This is serous cystic neoplasm, also known as serous cyst adenoma. This is the most common cystic neoplasm of pancreas. Cystic neoplasm of pancreas. It is benign. This is benign. And what are the characteristic features which are asked in relation to this tumor? There is central stellate scar. You can see here. There is central stellate scar, and radiology, in radiology also they ask this question, what kind of calcification is this? There is central sunburst calcification. So, this is central sunburst. What's the name, guys? This is central sunburst calcification. Clear? Central sunburst calcification. You know, this is cystic neoplasm. So, it is cystic neoplasm. If you perform aspiration of cyst, what will you get? Tell me. Name is serous cystic neoplasm. If you perform aspiration, what you get? Serous material. This is benign. So, CEA will be high or normal? It is normal or low. Pancreatitis is not seen. So, amylase is normal or low or high? Obviously, it is normal or low. So, you can see here serous cystic neoplasm. So, content is serous. If you see CEA, since it is benign, there is normal or low CEA. If you see amylase, amylase is also normal or low. Amylase is also normal or low. So, this is serous cystic neoplasm. There is mucinous cystic neoplasm. In mucinous cystic neoplasm, the content is mucinous. That is pre-malignant. That is why CEA is high, but pancreatitis is not seen. And the third is intraductal papillary mucinous neoplasm, where there is mucinous content, CEA is also raised, amylase is also raised. Got it? So, this is cystic neoplasm of pancreas. Next, you already know this question. This was asked almost every year. This was asked in each and every exam, and we are also expecting this question again in the exam. Where is the coin? So, guys, if it goes in the trachea, you can see here in trachea, if coin goes on chest X-ray PA view, you can see the edge. What you can see here? You can see the edge. On lateral view, you can see the flat surface. Flat surface. And what will be the symptom if the coin is in trachea? If the coin is in the trachea, patient will be having, yes, tell me, dyspnea. Whenever coin is in the esophagus, patient will be having dysphagia. And on PA view, you can notice that. On PA view, you can notice that flat surface of coin, flat surface. And here on lateral view, what we can see the edge. So, on the lateral view, we can see the edge. Got it? So, it is very, very easy. Now, see the question which is asked in exam. ज़्यादातर ऐसे इसी question के आने के chances बहुत ज़्यादा है. You can see this is the patient, yes, in which the coin is there on X-ray. Guys, tell me, where is the coin? This is PA view. This is lateral view. Where is the coin? This is the question which is asked in exam, guys. So, all of you know coin is there in the esophagus. So, coin is there in the esophagus. Clear? So, here the coin is in the esophagus. Next, the coin is in the esophagus. It is in the esophagus. Okay. Next, see this one. First, see the first chest X-ray. Newborn baby. who is having respiratory distress, right? Pediatrician noticed that respiratory distress and send this baby for chest x-ray, right? In the second case, he inserted the Ryle's tube and again he sent this baby for chest x-ray. Guys, tell me the diagnosis. Everybody is correct. You know, this is congenital diaphragmatic hernia. It is more common on left side or right? Left. What is the name, guys? Morgagni or Bokdalek? So, it is Bokdalek. So, you can see here, this is Bokdalek hernia. It is more common on left side. Bag and mask ventilation is contraindicated. Most common cause of death, pulmonary hypoplasia followed by pulmonary hypertension. On this x-ray, you are going to notice that multiple bowel loops in left hemithorax. On this x-ray, you can notice that coiling of Ryle's tube in the stomach, which is located in thorax. So, here what is the content? The most common content in Bokdalek hernia is small intestine, and here what is the content? Stomach. The content is stomach. Clear? So, content is stomach. It is characterized by a triad. How to remember? Mnemonic is RDS. What is RDS? Respiratory distress, dextrocardia, scaphoid abdomen. So, this is Bokdalek hernia. Got it? Very important. We are expecting a question related to congenital diaphragmatic hernia. Okay. Next. Easiest. Multiple times you got this question. Guys, tell me what's the name of this diverticulum? I'm waiting. Guys, tell me what's the name? Zenker's diverticulum. Clear? You can see this is Killian's dehiscence, and via Killian's dehiscence there is herniation of only mucosa and submucosa. So, if there is herniation of only mucosa and submucosa, tell me it's a true diverticulum or false? It's a true diverticulum or false? So, obviously it's a pseudo diverticulum. It's a pseudo diverticulum. It's a false diverticulum because it contains only mucosa and submucosa. What's the big problem over a period of time? Whatever the content patient is going to eat, whatever the food patient is going to take, liquid patient is going to drink, the food and fluid can collect here. And if food and fluid is going to collect, what will happen? Yes, there are chances of aspiration. And if there is aspiration, what will happen? There is pneumonitis. After that, there is lung abscess. So, can you tell me what is the most common complication of Zenker's diverticulum? Guys, tell me. Most common complication of Zenker's diverticulum. I am waiting for your reply. Neeraj Bind is the first person. First person is Neeraj Bind. Because of aspiration, there is lung abscess. So, most common complication, lung abscess, and chronic inflammation is going on. Because of this chronic inflammation, there is increased risk of one malignancy. What? Squamous cell carcinoma. How to make the diagnosis? You can see this is barium swallow. What's the treatment? Cricopharyngeal myotomy with diverticulopexy. One of the treatment is Dohel-Mann's procedure, in which we perform endoscopic stapling. So, that is known as diverticuloesophagostomy, right. So, one of the treatment is Dohel-Mann's procedure, but this is not the treatment of choice. You know what is Dohel-Mann's procedure, right. So, there is endoscopic stapling of septum. So, what happens? There is communication between diverticulum and esophagus. The name is diverticuloesophagostomy. So, what's the name, guys? Diverticuloesophagostomy. Clear? So, this is Zenker's diverticulum. Next, easiest. We are expecting one question from achalasia cardia or diffuse esophageal spasm. All of you know this is bird beak sign. This is rat tail sign, also known as pencil tip appearance. Bird beak, rat tail, pencil tip. So, this is achalasia cardia. Achalasia cardia is a motility disorder. So, can you tell me what is the investigation of choice for diagnosis? I am waiting for your reply, guys. Tell me. In achalasia cardia, obviously, in achalasia cardia, there is dysphagia more to liquids. Dysphagia more to liquids, this is the clue. Dysphagia mainly or more to liquids followed by solids. Investigation of choice for diagnosis is manometry, and all of you know what's the treatment of choice. Guys, what is the treatment of choice? Heller's laparoscopic, Heller's cardiomyotomy. So, treatment of choice, we go for laparoscopic, Heller's cardiomyotomy. So, it is laparoscopic, Heller's cardiomyotomy, Heller's cardiomyotomy. So, it is laparoscopic, Heller's cardiomyotomy, cardiomyotomy, easy. So, laparoscopic, Heller's cardiomyotomy. Okay. Next, guys, easiest question, what's the name? This is diffuse esophageal spasm, and in this diffuse esophageal spasm, what you can see? What is the name of this appearance? This is corkscrew, also known as rosary bead, also known as pseudo-diverticular appearance. So, name, this is known as corkscrew, corkscrew, rosary bead, rosary beads, pseudo-diverticular appearance. Rosary bead. Clear? So, you can see here, this is corkscrew, also known as rosary bead, also known as pseudo-diverticular appearance. Okay? This is very important, almost every year in 1 or 2 exams you are going to get it. So, corkscrew, rosary bead or pseudo-diverticular appearance, it is seen in diffuse esophageal spasm. Clear? Next question guys, you can see this one. This is the endoscopic finding, and on this endoscopic finding what you can see, there is tongue-like projection. Can you see here tongue-like projection? Here red velvety mucosa having tongue-like projection. This mucosa is pale. If this mucosa is pale, obviously this is squamous. This is the squamous, and if this is red velvety, this is columnar. So, obviously what is this actually? This is columnar metaplasia. Can you tell me this is gastric metaplasia or intestinal metaplasia? Everybody is correct. Yes, this is Barrett's esophagus. Guys, tell me. This is Barrett's. This is Barrett's esophagus. Barrett's esophagus. So, this is gastric metaplasia or intestinal metaplasia? Guys, tell me. Easy question. So, it is gastric metaplasia or intestinal metaplasia? Yes, intestinal metaplasia. Why? Because you are going to get the goblet cells. Since you are getting goblet cells, how to make the diagnosis of Barrett's esophagus? You know this is a pre-malignant condition, risk factor for adenocarcinoma. So, you have this endoscopic appearance. So, we go for endoscopy. You should be detecting goblet cells. So, that is why here the investigation of choice for diagnosis for Barrett's, it is endoscopy with biopsy. So, what is the investigation of choice guys? It is endoscopic biopsy. So, endoscopy plus biopsy, this is Barrett's. Next, easiest question, this is barium swallow, and on the barium swallow what is this appearance guys? What is the name? This is apple core appearance. So, all of you know that this apple core appearance on barium swallow, it is seen in carcinoma esophagus, carcinoma esophagus. And one easy question I am going to ask, suppose there is apple core appearance, you can see this is apple core appearance. So, this is the tumor, this part is tumor, only the center part of lumen is patent. So, you can see the flow of barium. If the question is apple core appearance on barium enema, it is seen in which condition? Tell me. Apple core appearance on barium enema, seen in which condition? Yes, colorectal cancer, very good, it is carcinoma colon, not in rectum actually, it is seen in carcinoma colon. So, it is seen in carcinoma colon, apple core appearance in barium enema, carcinoma colon, here barium swallow, carcinoma esophagus. Next, tell me, again this is barium swallow, what is the name of this appearance and what is the diagnosis? Guys, tell me, it is a benign tumor or malignant tumor? Tell me, it is a benign tumor or malignant tumor? Very good. First person to reply correctly, Lone Bilal, Dr. Sneha, there is punched out defect. So, this is the punched out filling defect, it is seen in leiomyoma. And what is leiomyoma guys? Leiomyoma, it is the most common benign tumor of esophagus, most common benign tumor of esophagus, diagnosed by barium swallow. And can you tell me the treatment of choice? What is the treatment of choice of leiomyoma? All of you know this is enucleation. So, what is the treatment of choice for leiomyoma? This is enucleation, clear? So, the treatment of choice is enucleation, this is leiomyoma. Next, tell me what is the diagnosis? Can you see there is concentric symmetric narrowing typically at squamo-columnar junction, and it is having only mucosa and submucosa. There is symmetric concentric narrowing at squamo-columnar junction, typically. What is the name of this ring? Everybody is correct. This is Schatzki's ring. This is Schatzki's ring, and since it is a ring, what will happen if patient is going to eat a solid food stuff, especially the meat, that meat is going to stuck. So, what will happen? Sometimes patient is having episodic aphasia if a large piece of meat is stuck. So, there is dysphagia and episodic aphasia. So, here you can see this ring. What is the name? Schatzki's ring. It is composed of mucosa and submucosa. What is the location? Squamo-columnar junction. If patient is symptomatic, we just go for dilatation. Surgical excision should not be done, otherwise there will be stricture. So, what is the name? Schatzki's ring. Next, guys, tell me, it is already written. Mallory Wiestier. I am asking the question, what is the most common site? What is the most common site? Tell me. It is cardia. Very good. Chetna, very good. It is cardia. So, it is located just below G junction. Here, there is partial tear involving only mucosa and submucosa. Here, after binge drinking, because of multiple vomiting, forceful vomiting, patient will be having bleeding. What kind of bleeding? Tell me, it's painful or painless? Easiest question, there is painful bleeding or painless bleeding? After binge drinking, yes, it's painless bleeding, and in majority of cases only minor bleeding is there. Hematemesis occurs in 20% cases. So, in 20% cases there is hematemesis, means massive bleeding, otherwise there is minor bleeding. Two questions are there. One, after binge drinking, if patient is having thoracic pain, vomiting, cervical subcutaneous emphysema, that is known as macular striae. So, this is Boerhaave syndrome. And after binge drinking, if there is hematemesis, it is painless. This is Mallory-Wiestier or Mallory-Weiss syndrome. Got it? Mallory-Wiestier or Mallory-Weiss syndrome. Clear? So, remember, binge drinking, thoracic pain, vomiting, cervical subcutaneous emphysema, that is macular striae, Boerhaave syndrome. Painless bleeding, this is Mallory-Weiss syndrome. Next, it is looking like watermelon. What is the name? Obviously, you know that it is watermelon stomach. Guys, can you tell me what's the other name? Other name of watermelon stomach? GAVE. What is the full form of GAVE? Gastric antral vascular ectasia. So, everything is written here. Can you tell me what is the most common site? Gastric antral, antrum. Most common site is antrum. What is the pathology? Vascular ectasia. So, pathology is vascular ectasia. Why it is known as watermelon? Because if you perform endoscopy, you can notice that this kind of parallel stripes of vessels near the antrum. So, parallel stripes of vessels are there near the antrum on endoscopy. On biopsy, there should be vascular ectasia. So, here investigation of choice is endoscopy plus biopsy, and all of you know what's the treatment. Treatment is argon plasma coagulation. What you do? You obliterate these vessels. So, it is APC, argon plasma coagulation. If this facility is not available, in those cases we go for endoscopic electrocoagulation. So, what is the name? GAVE. There is occult bleeding. Because of this occult bleeding, some patients are having anemia. Okay. So, this is watermelon stomach. Next, guys, tell me what's the name of this condition? This is barium meal. On this barium meal, can you tell me what's the name? This is barium meal. It is looking like this leather bottle. So, leather bottle, what is the name? This is Linitis plastica. So, name of this condition, this is known as Linitis plastica. Linitis plastica, also known as leather bottle stomach. What is the problem? There is fibrosis in submucosa. Because of that, what is the symptom? There is early satiety, because stomach loses the property of distensibility. So, these patients are having early satiety. Patients are having early satiety because stomach loses the property of distensibility. So, this is Linitis plastica. Very good, Prakhar, Hemant, Amitesh, Mani Tripathi, Avdesh, Twinkle Kia. Very good. Next, first 1, 2, 3. This is 1, this is 2, this is 3. Tell me, what is the diagnosis in first one? See the first picture. Guys, tell me the diagnosis. Waiting for your reply. Dr. Sneha, you are absolutely correct. You are going to notice what? This is single bubble. Can you see this bubble? The whole stomach is distended. So, this is single bubble. This is CHPS or IHPS, infantile hypertrophic pyloric stenosis. This is single bubble. Okay, you can see the second picture. How many bubbles you can see in this second picture? You can see the stomach, you can see the duodenum. So, here this is double bubble. Can you tell me the diagnosis, guys? This is double bubble. Tell me the diagnosis. Duodenal atresia and annular pancreas. So, it is seen in duodenal atresia. Apart from duodenal atresia, it is also seen in annular pancreas. Clear? So, annular pancreas. So, it is duodenal atresia and annular pancreas. Clear? This is double bubble, and you can see this one triple bubble. This is 1, this is 2, this is 3. It is seen in jejunal atresia. So, triple bubble, it is seen in jejunal atresia. Jejunal atresia. Clear? So, it is seen in jejunal atresia, right. So, both of all these three questions, single bubble, double bubble, triple bubble, very important, multiple times these questions were asked. Next, can you tell me the diagnosis here? Easiest question. You can see this chest X-ray, and on this chest X-ray, what is the diagnosis, guys? Tell me. Here, what is the diagnosis? You can see there is free gas under right dome of diaphragm. So, this is pneumoperitoneum, and it is because of perforation peritonitis. The question language in exam will be, this X-ray will be given and they will ask you treatment. First, resuscitate the patient. So, we go for IV fluids, and after that take the patient for laparotomy. So, this is pneumoperitoneum. This is free gas under right dome of diaphragm. So, this is pneumoperitoneum. In this case, what you do, first go for IV fluids, means we resuscitate the patient, and after resuscitation we go for exploratory laparotomy. After resuscitation we are going for exploratory laparotomy. Got it? So, this is free gas under right dome of diaphragm, pneumoperitoneum. Next, guys, tell me what's the diagnosis here? Easiest question. If you see, there are two views. This is supine, and if you see this one, this is erect or upright. Erect or upright. In the supine view, if you can see this, yes, you can notice that, yes, there are circumferential ring-like pattern. If you can see these circumferential ring-like pattern, can you tell me what is the name of this circumferential ring-like pattern? This is known as volvuli conniventis. Very good, Gautam Rao. This is volvuli conniventis, and it is seen in jejunum. If jejunum is visible, it means where is the obstruction? In ileum. So, the patient is having small bowel obstruction, and on this erect view you can see this pattern. Guys, can you tell me what is this pattern? This kind of pattern is there. What is this pattern? Tell me. What is this pattern? Tell me. Yes, PrepLadder pattern. Very good. PrepLadder. Yes. So, in PrepLadder, it is step ladder. Very good. So, it is PrepLadder, not PrepLadder, step ladder. Got it? So, in PrepLadder, there is step ladder. So, what? In erect view, you are going to see this step ladder pattern. Okay, you remember? So, whenever in exam this question comes, first thing should come in your mind, PrepLadder, step ladder. Okay. So, PrepLadder, step ladder. So, guys, it is small bowel obstruction. You can see the bowel loops are placed centrally, narrow in caliber, there is volvuli conniventis, this is small bowel obstruction. So, it is small bowel obstruction. Clear? So, small bowel obstruction. Okay. Sometimes examiner is asking large bowel obstruction also. You can see this one. Large bowel obstruction is very, very easy. Why? Because these are wider in caliber. These bowel loops are wider in caliber. You can see these are haustration. There are haustrations. This is wider in caliber. There are fib bowel loops. What is the location? Placed peripherally. So, wider in caliber, placed peripherally, there is presence of haustration, guys. And here also PrepLadder, step ladder pattern. So, this is step ladder pattern. This is large bowel obstruction. And मैं आपको बता दूँ, ज़्यादातर एग्जाम में examiners are asking small bowel obstruction because large bowel obstruction is very easy. Most of you can easily diagnose it. Clear? So, this is large bowel obstruction. There is haustration, wider in caliber, fib bowel loops placed peripherally. So, small bowel, large bowel obstruction. Next, every year you are getting this question in one or two exam, either in INI-CET, NEET PG or FMGE. What class sign? So, you can see here, guys, on barium enema, this is the class sign, and when one loop enters into another, you can see these linings, and it looks like what? Coiled spring sign. So, this is the class sign, this is coiled spring sign. There are high chances that we are going to get a question in upcoming exam. Into susception से एक question हमेशा आता है. So, claw sign or coiled spring sign. Got it? So, claw, coiled spring sign. Next, tell me, guys, This is barium enema, and in this case there is bird beak sign on barium enema. बर्ड बीक साइन ऑन बेरियम इनिमा. एग्जाम में प्रॉब्लम क्या होती है, जैसे ही कोई क्वेश्चन आता है जैसे बर्ड बीक साइन, कुछ लोग इन्वेस्टिगेशन पढ़ते ही नहीं, उनको लगता है कि मिल गई मेरी बर्ड बीक, अब कहाँ गया मेरा एक्लेजिया. ओके, सो यू हैव टू रीड इट whether it is barium swallow or barium enema. So bird beak on barium enema. Guys, tell me in which condition? Sigmoid volvulus. So this is barium enema, and it is seen in sigmoid volvulus. Okay, so it is seen in sigmoid volvulus. Clear? Sigmoid volvulus. इसलिए आधा अधूरा क्वेश्चन नहीं पढ़ना है. रीड द क्वेश्चन कम्प्लीटली. Read the question completely or the 4 options completely, then mark the correct answer. This is bird beak sigmoid volvulus. Next. Every year you are going to get this question in 1 or 2 exams. What is the name, guys? You know, this is coffee bean. There is another sign here, bent inner tube. There is another sign here, omega sign. So coffee bean, bent inner tube, omega sign. Clear? So coffee bean, bent inner tube, omega sign. So coffee bean, there is bent inner tube, omega sign. You can see bent inner tube sign. So bent inner tube, or you can see here omega sign. Omega sign. Clear? So bent inner tube sign, omega sign. Got it? This is very important. This is sigmoid volvulus. So you saw here, what's the diagnosis here? This is sigmoid volvulus. Guys, this is sigmoid volvulus. Clear? Now see the next one. You can see the next one. This is also a bean. और जब ये क्वेश्चन एग्जाम में आता है, मेजॉरिटी ऑफ यू आर गोइंग टू मार्क सिग्मॉइड वॉलुलस. दिस इज नॉट कॉफी बीन. व्हाट काइंड ऑफ बीन इज दिस? दिस इज किडनी बीन, एंड एवरीबडी इज मार्किंग द आंसर करेक्टली. सिंस इट इज किडनी बीन, इट इज सीन इन सीकल वॉलुलस. दिस इज द किडनी बीन sign, so it is seen in cecal volvulus. Cecal volvulus, you know that cecal volvulus is C clockwise, there is comma shaped cecum. What? You can see it's like this. So comma shaped cecum or kidney bean. Remember this. This is kidney bean sign or comma shaped cecum. Clear? So this is kidney bean sign, comma shaped cecum. Next. Can you tell me what is the diagnosis in this case? Okay, let me tell you first. See this is the IC junction. If IC junction is here, it is reaching in the lumbar region, right lumbar region almost. It means the cecum is pulled up. And if there is pulled up cecum, second thing you can notice that this is the stricture, and because of the stricture, it is looking like string. And what is the name? This is known as string sign of Cantor. So this is known as string sign of Cantor. And here can you see, guys, this is pulled up cecum. Pulled up cecum. Can you tell me the diagnosis? Who is marking Crohn's? Very bad. In Crohn's there is no pulled up cecum. Very bad. In Crohn's there is no pulled up cecum, guys. String sign of Cantor is there in Crohn's. In tuberculosis there is Sterling sign, string sign of Cantor both. But pulled up cecum, obtuse IC angle, yes, all these gooseneck appearance, yes, all these are seen in tuberculosis. So this is GI tuberculosis, gastrointestinal tuberculosis. Okay, so this is tuberculosis. Remember, Sterling sign, string sign of Cantor. It is because of ulcer, because of stricture. Ulcer and stricture in ileum, it can be seen in tuberculosis, it can be seen in Crohn's. And you know, in tuberculosis what kind of ulcers are there? Transverse, typhoid, longitudinal ulcer. Got it? So here it is tuberculosis. Next, guys, easiest question. There is a single diverticulum on anti-mesenteric border, which is true diverticulum containing mucosa, submucosa, muscularis propria. All of you know what's the diagnosis? Meckel's diverticulum. It is characterized by which rule? Rule of 2. You know, it is congenital. So 2% population, 2 inches in length, located 2 feet proximal to IC junction. Symptomatic patients are less than 2 years of age. Now you have to tell me, what is the most common ectopic mucosa? Guys, tell me, what is the most common ectopic mucosa? Mucosa. And how to remember, guys? It is GPC. GPC, that is gastric followed by pancreatic followed by colonic. It is GPC, gastric, pancreatic, colonic. And you know that if there is gastric mucosa, because of that there is increased acid secretion, because of that ulcer. So what is the most common manifestation? It can lead to bleeding. How you can detect the bleeding? Technetium per technate scan. That's why you know that investigation of choice, it is technetium per technate scan. Clear? So, these are important questions. Technetium per technate scan, most common manifestation bleeding, and the most common symptom in adults, that is abdominal pain. Clear? So, this is Meckel's diverticulum caused by persistent vitello-intestinal duct. Okay? Next, tell me the diagnosis. Very easy question. You can notice that here this kind of appearance is there. Can you see what kind of appearance? This kind of appearance. This is the appearance. Can you tell me, guys, what is the name of this appearance? Sawtooth. It is not diverticulitis. It is colonic diverticulosis. So, this is sawtooth appearance. Name, this is sawtooth. Sawtooth appearance, and it is seen in colonic diverticulosis. Can you tell me the name of this investigation? This is colonic diverticulosis. Obviously, which investigation is this? This is barium enema. So, on barium enema, there is sawtooth appearance. On barium enema, guys, you can see there is sawtooth appearance. So, this is what? This is colonic diverticulosis. Colonic diverticulosis. Clear? Next, tell me, what is this appearance? Guys, tell me. Easiest question. See this carefully. See this image carefully. ये आपने लगाया, ये मैंने लगाया, ये आपने लगाया. बताइए, what's the name? Yes, and you can see here. Here also you can notice. Clear? And on CT also. See, it's very beautifully seen on the CT. Can you see this? These. What is this? Thumb printing. So, everybody is correct. This is known as thumb printing, and thumb printing, it is seen in ischemic colitis. So, one question for all of you, what is the most common site of ischemic colitis? You know the diagnosis. This is thumb printing. This is thumb printing. Thumb printing, and it is seen in ischemic colitis. So, guys, what is the most common site of ischemic colitis? Dr. Sneha, very good. Chetna, very good. Twinkle, very good. Weevil, YY, very good. YY. So, it is ischemic colitis. Most common site, splenic flexure of colon. Guys, it is ischemic colitis, and the most common site, splenic flexure. This is splenic flexure of colon. So, it is splenic flexure of colon, that is thumb printing. Okay. Next, we already discussed this is barium enema, and on this barium enema we already discussed it is looking like apple core. So, this is looking like apple core. On barium enema, it is seen in which malignancies? Tell me. This is apple core. On barium enema, carcinoma colon. Everybody is correct. This is carcinoma colon, and this is apple core appearance. So, this is apple core appearance. Clear? So, this is apple core appearance. It is seen in carcinoma colon. So, this is barium enema. Okay. Next, you can see this one. Very easy question. It is going to look like one instrument. See here, there is pseudomembrane, and if you see CECT, it looks like this musical instrument. Can you see? This is the colon. Inside the colon, you can see the pseudomembrane. It is looking like this musical instrument. Guys, tell me what's the name? All of you are correct. This is accordion sign, and you know that accordion sign, it is seen in which condition? Pseudomembranous colitis. So, what is the diagnosis here? This is pseudomembranous colitis caused by Clostridium difficile. So, it is pseudomembranous colitis. Name of this musical instrument? Accordion. So, what is the name? Name of this sign? Accordion sign. The name of this sign, this is accordion sign. So, this is pseudomembranous colitis. Name of this sign? Accordion sign. Clear? This is accordion sign. Next question, guys, tell me. Somebody was asking that sting sign of Cantor. Now, see this. In this case, you can notice that there is long hose pipe stricture of terminal ileum. Can you see this? In the terminal ileum, there is long hose pipe stricture. And whenever you are going for barium meal follow through, on barium meal follow through, you are going to notice that there is sting sign of Cantor. Now, tell me the diagnosis. Now, tell me the diagnosis. Yes, this one is Crohn's disease. So, there is long hose pipe stricture of terminal ileum, and it corresponds to string sign of Cantor. So, this is Crohn's disease. Crohn's disease. There are some signs of Crohn's disease as well as ulcerative colitis which are asked frequently. One of this is string sign of Cantor. Okay. Now, see the next one. Guys, can you see here? There is no hostrations in the colon. Absence of hostrations. This is known as a hostile colon, also known as lead pipe sign, also known as pipe step colon, also known as garden hose appearance, also known as stovepipe. So, how to remember? LPG stovepipe. LPG stovepipe. LPG stovepipe is the mnemonic. L lead pipe sign, P pipe stem colon, G garden hose appearance, stovepipe, that is stovepipe appearance. Got it? And all of you know it is typically seen in which condition? Ulcerative colitis. So, guys, it is typically seen in ulcerative colitis and this was asked multiple times in exam. Clear? So, Crohn's disease, ulcerative colitis. Next question, see this one. This patient is having multiple, tell me what is this? What is this? Multiple. The patient is having multiple fistula. Doc, very good doc. Deepak Agrawal, patient is having multiple fistula in ano. Fistula in ano. And nowadays, one of the commonly used treatment in fistula in ano, is this one. Tell me what's the name? What's the name of this condition? What's the name of this? You can see this, a nylon tape used here. Sometimes we are using a suture, a thread. What is the name? This is seton. Seton. So, this is a seton used here. Mainly we are using two kinds of seton. One is cutting seton and the second is non-cutting seton. What is the role of cutting seton, guys? It is going to cut a high-lying fistula into low-lying fistula. So, it converts high-lying fistula into low-lying fistula, high-lying into low-lying. And non-cutting seton, mainly it is going to control the infection. So, whenever some pus collection is there, infection is there, it is going to drain it. Can you tell me what are those two conditions where patient is having multiple infected fistula? Guys, tell me two conditions where patients are having multiple infected fistula, where we are using this non-cutting seton. Dr. Rafa, you are correct. Dr. Sneha, you are correct. HIV positive and Crohn's disease. So, in HIV positive and Crohn's disease, we are using non-cutting seton. Clear? So, guys, this is seton used in the management of fistula in ano. Okay? Now, you can see the next one. Tell me, guys, what's the diagnosis here? Yes? Very good. So, what's the diagnosis? It is rectal prolapse. It is full thickness rectal prolapse. And you know, this full thickness rectal prolapse, it is seen in children or adults? Full thickness rectal prolapse, this is seen in adults. And here you can see only prolapse of mucosa. So, this is mucosal prolapse. This is mucosal prolapse, and you know that this mucosal prolapse, it is seen in children. Mucosal prolapse, it is seen in children. Got it? In adults, we have two options for rectal prolapse, rectopexy. One is abdominal, second is perineal. How to remember? Abdominal mnemonic is VAR. So, what is VAR? It is Wells and Ripstein. So, guys, it is Wells and Ripstein, that is abdominal. And for perineal, the mnemonic is PAD. So, rectopexy in perineal, it is PAD. A means Alzheimer's. This is Alzheimer's. D means Delorme. So, it is Alzheimer's and Delorme. Clear? So, abdominal, perineal, abdominal rectopexy VAR, Wells abdominal Ripstein, perineal it is Alzheimer's Delorme. Clear? So, these are questions related to rectal prolapse. Okay. Next, you can see, tell me, see this and tell me what is the diagnosis. Can you see this small opening in postnatal cleft region overlying the coccyx? Small opening, guys, tell me, this is the small opening in this hairy male. Pilonidal sinus. What is the treatment of pilonidal sinus? You are going to excise the whole sinus tract, and after that you have to cover this defect with the flap. So guys, can you tell me what are the flaps used in pilonidal sinus? Easy question. This is pilonidal sinus. Very good. What are the flaps used? Very good. Very good. So it is Limburg's flap, Karidaki's flap, Limburg's name of flaps, Limburg's flap, Karidaki's flap, Karidaki's. We are using rhomboid flap. Sometimes they ask which flap is used, rhomboid flap, and there is a procedure in which both of these are included, means excision of tract and closure, both of these are included. And what is the name of that procedure, guys? Tell me, what's the name of that procedure? Name of procedure is Bascom procedure. So what is the name of procedure? The name of procedure is Bascom procedure. So it is the Bascom procedure which is done. So this is pilonidal sinus, pilonidal sinus. It is not Gascon, it is Bascom. Okay. Next, easiest question, and 100% chances are there that we are going to get one of these questions. So you can see the first one, this is omphalocele, also known as exomphalos. Second one, this is gastroschisis. Gastroschisis, guys, you know that in omphalocele, bowel is covered by two layers. Which one is the outer layer? Outer layer is amnion. So the outer layer, this one is amnion, and the inner layer is peritoneum. So there is inner layer, peritoneum. So outer layer is amnion, inner layer is peritoneum. How to remember? Peritoneum is in, so the mnemonic is pin. Pin, peritoneum is in. What is the biggest problem with omphalocele? That it is associated with trisomies. Which trisomies? You know, 13, 18, 21. It is associated with congenital malformation. Which one? Cardiovascular. And what is the most common cause of death? Congenital malformation. That's why in omphalocele, prognosis is poor. Poor prognosis. And if you see this gastroschisis, can you see here? On the right side of umbilical cord, there is splitting of abdominal wall, bowel is exposed. So intestinal atresia, bowel related complications are more, but here prognosis is relatively better. Why prognosis is relatively better? Because it is not or rarely associated with congenital malformations. So this is gastroschisis. I am telling you, फिर से मैं बता रहा हूँ, 100% chances हैं that we are going to get a question either in NEET PG or FMGE. आएगा ही है. Clear? Next. Tell me, what is this crystal, guys? कैसा दिख रहा है? The crystal looks like envelope shaped or bipyramidal. This is envelope shaped or bipyramidal. Can you tell me in which stone this crystal is seen? Bipyramidal, and all of you know calcium oxalate dihydrate. It is seen in calcium oxalate dihydrate. Clear? So calcium oxalate dihydrate. You can see the next one. It is looking like hourglass or dumbbell shaped. Can you see the shape? It is looking like hourglass or dumbbell shaped. This is dumbbell. Hourglass or dumbbell shaped. Dumbbell shaped. And you know that this is seen in calcium oxalate monohydrate. So this is calcium oxalate monohydrate. And how to remember? It's very, very easy. All of you know that mnemonic, Mona is dumb. So it is calcium oxalate monohydrate, hourglass or dumbbell shaped, Mona is dumb. Okay. Next, I am telling you again, we are expecting one question out of crystals. Okay. So you can see this crystal. What is this crystal? This is coffin lid. It's looking like coffin lid. And coffin lid crystal is seen in which condition, guys? Coffin lid crystal, it is seen in which condition? Yes. What is the name of this stone? Struite. And what is the other name of struite stone? This is also known as triple phosphate, also known as staghorn. Can you see? It looks like horn of stag. So staghorn or horn of stag. So triple phosphate, calcium, magnesium, ammonium phosphate, staghorn calculi, also known as struite stone. And last year in NEET PG, this crystal was asked. Tell me, what is this crystal? It is looking like benzene, hexagonal. So it is benzene shaped or hexagonal. Okay. So this is benzene shaped or It is looking like hexagon. So, hexagonal, and all of you know this is seen in cysteine. What is the hardest stone? Hardest stone, cysteine is the hardest stone in which you are going to find this benzene shaped or hexagonal crystals. So, crystals are very, very important. We are going to get a one question from the crystals. Next, this was asked multiple times in exam. In the kidney, can you see? Relatively black lesions. Okay, can you see this? Yes, relatively black. It means what? It contains fat. Can you see these lesions? These are the lesions, and see the appearance. It is smooth rounded. So, this is actually what? Angiomyolipoma. So, what's the diagnosis, guys? This is angiomyolipoma. This is angiomyolipoma. It contains fat which is having minus 20 Hounsfield unit on CT. That is why it appears relatively black. How to differentiate angiomyolipoma from RCC? There is presence of fat, there is absence of calcification. So, you can see this is angiomyolipoma. This was asked 2 to 3 times. ज़्यादा chances के आने के. Okay. So, this is angiomyolipoma, and now see this one. Can you see here? Irregular enhancement because of this hemorrhage and necrosis. There is necrosis, because of that there is irregular enhancement, and you can notice that there is invasion of this vascular structure, renal vein. So, there is renal vascular invasion, there is irregular enhancement because of areas of necrosis. So, guys, what is the diagnosis here? This is RCC. So, renal cell carcinoma, there is calcification, there is irregular enhancement because of necrosis, renal vein invasion or vascular invasion. So, it is RCC, renal cell carcinoma. Okay. Next, tell me what is the most common site of metastasis in RCC? Easy question. There is hematogenous spread. So, because of this hematogenous spread, what is the most common site of metastasis? Easy question, guys, tell me. Lungs. And in lungs you can notice that this kind of appearance is there. What is the name? All of you know, it is looking like cannonball. So, guys, what is the name? This is cannon. Can you see here? This is cannon. So, these are cannonball secondaries, right? So, these are cannonball secondaries. What is the primary? RCC, and metastasis occurs to the lungs, cannonball secondaries. Easy. Next, I am 100% sure that there will be one question related to tuberculosis. Can you tell me? There is kidney which is filled with cheesy material. Can you see this cheesy material? So, kidney is filled with cheesy material. What is the name of this condition? Tell me. Kidney is filled with cheesy material. What is the name? Putty kidney. Putty kidney. You have seen the ad in the TV. आपने देखा है टीवी में ad कि पेंट करने से पहले क्या लगाना है? पुट्टी. कौन सा? बिरला वॉल पुट्टी. ठीक है. सो अभी बिरला का पुट्टी भी लगाना है और सीमेंट भी कौन सा लगाना है? बिरला सीमेंट. So, what will happen? Putty kidney, and whenever it is calcified, it is going to calcify. This calcified kidney is known as cement kidney. So, putty वो भी बिरला का, cement वो भी बिरला का. So, putty kidney, when it is calcified, it is known as cement kidney. Remember, putty kidney, cement kidney. याद रहेगा. Whenever you will get this ad, JK wall putty, बिरला cement. Putty kidney, cement kidney, and whenever kidney is calcified, its function is gone, and when the function is gone, this is known as autonephrectomy. So, this is putty kidney, cement kidney, function is gone, autonephrectomy. And let me tell you the clue. What clue you are going to expect in exam? आपको exam में कौन सा clue मिलेगा? Examiner will give you sterile pyuria. Whenever examiner is going to ask you a question related to genitourinary tuberculosis, there will be sterile pyuria, means pus cells will be in the urine. There is no growth on culture sensitivity. Clear? So, sterile pyuria. These are the clues. Putty kidney, cement kidney, calcified kidney, autonephrectomy, sterile pyuria. Next, guys, easy. Can you see this? Ureter is going behind IVC. Actually, ureter is normal. IVC is abnormal. लेकिन IVC strong structure है. That's why ureter has to change. And if you perform IVP, this kind of appearance is there. Since ureter is going behind IVC, it is known as retrocaval ureter. So, what is the name of this condition? Retrocaval. Retro means behind. So, this is retrocaval ureter. And guys, can you tell me the name of this appearance? It is looking like reverse J, fish hook, chamfered crook appearance. So, reverse J, fish hook, chamfered crook appearance, clear? Chamfered crook appearance. So, it is seen in retrocaval ureter. Which structure is normal? Ureter is normal. Which one is abnormal? IVC. What is the diagnosis? Investigation of choice for diagnosis MRI. और आप treatment क्या करेंगे? ऐसा ureter cut करिए and after that you perform the anastomosis between the ureter. So, relocation ureterostomy. You relocate the ureter and perform the anastomosis. So, this is relocation ureterostomy. This is retrocaval ureter. These signs are seen on IVP. So, these are the signs which are seen on IVP. Clear? IVP. Next. Easiest question. If you can see the IVP, on this IVP you can notice that these are the two ureters. Can you see here? This is one and this is the second one. Both of these ureters are going to join here and after that these are going to drain into bladder. On the left side you are going to notice that, see this carefully. On the left side you are going to notice that this is one ureter and this is another ureter. Two ureters are there and you can easily find out the space between these two. So, this is one, this is two. इन दोनों के बीच में आपको space दिख रहा है. So, two ureters are having opening into bladder. So, what kind of duplication is there? If two different openings are there in the bladder, this is complete duplication. And if both ureters are going to join together before draining into the bladder, this is incomplete duplication. So, guys, what's the diagnosis here? On the right side, there is incomplete duplication. Incomplete duplication on the right side. On the left side, there is complete duplication. Complete duplication. और मैं आपको बता दूं, ये नीट पीजी और एफएमजी में एमसीआई वालों के पास सिर्फ एक ही आईवीपी है, यही वाला. तो आप देखेंगे दे आर गोइंग टू आस्क दैट राइट साइडेड इनकम्प्लीट डुप्लीकेशन विथ लेफ्ट साइडेड कंप्लीट डुप्लीकेशन. सो देर इज कंप्लीट डुप्लीकेशन बट यू हैव टू लुक फॉर दिस काइंड ऑफ अपीयरेंस. क्लियर कि दोनों ज्वाइन होकर बाद में ड्रेन कर रहा है, दोनों अलग अलग ड्रेन कर रहा है. सो दिस इज complete duplication if both ureters are going to drain separately and if both of these are going to fuse together before draining into bladder, this is incomplete. Got it? So, this is duplication of ureter. Now, guys, tell me what is the name of this appearance? Very easy. You can easily see drooping lily. And can you see the kidney? You can see the shadow of kidney here. This is the kidney shadow. This upper pole is not visualized. Why? Because it is non-functional. Because it is hydronephrotic. So, hydronephrotic upper pole is displacing the lower pole inferolaterally और इसको हम लोग बोलते हैं, we call it as drooping lily. Drooping lily. Can you tell me in which conditions you are going to find this drooping lily sign? I am waiting for your reply, guys. In which conditions you are going to find this drooping lily? Ronak, Dr. J. Rupa, very good. Lone Bilal, correct. First, neuroblastoma. Tell me another one. Hydronephrosis, very good. What condition? Ectopic ureteric orifice. So, whenever there is ectopic ureteric orifice. So, the patients who are having ectopic ureteric orifice, in that case also there is drooping lily sign. So, this is drooping lily sign. Okay, very very important, drooping lily sign. Next, easiest question. Multiple cyst in both kidneys, small cyst. All of you know the answer. ADPKD, autosomal dominant polycystic kidney disease. Can you tell me what is the abnormal protein? Polycystine. Can you tell me what are the chromosomes responsible? Chromosomes responsible 16 and 4. What is the most common cause of death? Cardiovascular disorders. Ultimately, patient will develop CRF. And since ultimately patient develops CRF, what is the treatment of choice? Tell me, guys. Ultimately, patient develops CRF, treatment of choice, renal transplantation. Next question, apart from kidney, which organ is also having the cyst? So, most common extrarenal manifestation of ADPKD. Most common extrarenal manifestation of ADPKD. Tell me. No, not the lungs. Yes, the white coat, you are correct. Nidhi, you are correct. Liver. And which organ is not having the cyst? Least chances of having the cyst, lung. So, remember, maximum chances of cyst in the liver. Polycystic liver disease, cysts are never seen in lungs. This is ADPKD. Next, guys, easiest question. You have seen it multiple times. Can you tell me what is this? You can see this is adder head or cobra head appearance, and you know in which condition you are going to find adder head or cobra head appearance. This is uretrocele. So this is बाईलैटरल यूरेट्रोसील. इसका मतलब आप देखिए दोनों तरफ है. ये कैसा है? ये है नागिन 2. यू रिमेंबर नागिन? सो एडर हेड, अब भूलेगा नहीं आपको, एडर हेड कोबरा हेड अपीयरेंस. अगेन एग्जामिनर के पास यही वाली इमेज है, सो दे आर आस्किंग दिस वन ओनली. सो एडर हेड और कोबरा हेड अपीयरेंस. सो दिस इज बाईलैटरल यूरेट्रोसील. सो दिस इज bilateral uretrocele. Clear? So this is bilateral uretrocele, adder head or cobra head appearance. Clear? Next, you can see this. This is antenatal ultrasound. During pregnancy, ultrasound was done, and this kind of appearance is there. This kind of appearance is there. Yes, very good. Ravi, Prakash, Deepak, it is keyhole. Keyhole, yes. Okay, anybody is from Assam or West Bengal? Anybody is from Assam or West Bengal here in the group? Yes. Yes. So in Assam and West Bengal, you know, see, okay, Raj Bhishek Mishra. So key means क्या? Key bolchi, keyhole. So key means क्या? Hole मतलब हाल. So keyhole. आज से आपको कोई भी बोले क्या हाल? Keyhole. And keyhole, it is seen in posterior urethral valve. So keyhole, okay. So Jadu Moni Deka, very good, Deka, right. So keyhole, clear. So keyhole, posterior urethral valve. So this is seen in antenatal, means ultrasound done during pregnancy. So this is posterior urethral valve, and the bladder is distended because here is the valve. So it's looking like keyhole. That's why the name is keyhole sign. So name is keyhole sign. There are high chances we are going to get this question. Keyhole sign. Keyhole sign. Okay. Next question, guys. Tell me. You can see this X-ray. Very easy, and it was asked multiple times. What you can see in this X-ray? In the first one, you can see the opacity. Typically in the pelvis. Clear? There is a stone, radio opaque, and here also you can notice that there is a stone which is having this kind of projection. So what is the name of this stone, guys? The stone is having this kind of projection. So this is known as jack stone. Jack stone. So this is bladder stone. You can see here. You can easily identify bladder stone on X-ray. This is jack stone, calcium oxalate dihydrate. It is seen in bladder. So one question I want to ask: how many bladders you have? Tell me, guys. Tell me how many bladders you have. How many bladders you have? Kia, Ravi Prakash, Minhas, how many bladders you have? One? No, you have two bladders. One is gallbladder and the second is urinary bladder. So you have two bladders, and in both bladders there are stone, right? And for both bladder stone, investigation of choice ultrasound. I hope you will not forget now. You have two bladders, and for both bladder stone, UB and GB. So UB stone, GB stone, for both. What is the investigation of choice ultrasound? You should not forget. So for UB stone, GB stone, investigation of choice ultrasound, right? तो जैसे ही bladder stone आएगा क्या मार्क करेंगे? Ultrasound. X-ray पे भी you can make the diagnosis, but investigation of choice ultrasound. Clear? Next, guys, see this. Can you see this? This patient is having bladder rupture, and on CT cystography this kind of appearance is there. Can you see here? आप देख सकते हैं इसमें आग जल रही है. Can you tell me what's the name? This is flame sign. You can see here it is looking like a fruit. Which fruit? Pear sign. Pear sign. And you can see it is looking like something. What? Looking like teardrop. So teardrop, right? So you can see here flame sign, pear sign, teardrop bladder. All these are seen in which bladder rupture? Tell me, intraperitoneal or extraperitoneal? Extraperitoneal bladder rupture. So these are seen in extraperitoneal bladder rupture. These are seen in extraperitoneal bladder rupture, and if it is extraperitoneal bladder rupture, you know that bladder is in pelvis. If bladder is in pelvis, which fracture is responsible for bladder rupture? Pelvic fracture. And all of you know what is the most common cause of pelvic fracture? Road traffic accident. So it is extraperitoneal bladder rupture caused by pelvic fracture, flame sign, pear sign, teardrop bladder. Clear? Now see the next one. Guys, tell me, easiest question, multiple times this question was asked. The bladder is exposed. There is absent infraumbilical abdominal wall. You can see this trigone and the urine will be dribbling from the trigone. Tell me the diagnosis. Yes, Yashti, very good Yashti, Gautam, Ravi Prakash, everybody is correct. This is ectopia vesicae. Guys, this is ectopia vesicae. This is also known as extrophy bladder. So, this is ectopia vesicae, also known as extrophy bladder. Extrophy bladder. So, there is absent infraumbilical abdominal wall, absent anterior wall of the bladder, there is exposed posterior wall. We have to close the bladder. We have to perform augmentation enterocystoplasty. So, after augmentation enterocystoplasty, you tell me there is one malignancy whose risk is increased. Which one? Guys, tell me which one. Which malignancy risk is increased? Which malignancy risk is increased? Yes, it is adenocarcinoma. So, there is increased risk of which malignancy? Adenocarcinoma. So, there is increased risk of malignancy. Which one? It is adenocarcinoma. Clear? Next, you can see this. What? The prepuce cannot be retracted over glans. So, prepuce, it cannot be retracted over glans. Clear? What is the name? Phimosis. So, prepuce cannot be retracted over glans. This is phimosis. So, prepuce cannot be retracted over glans. This is phimosis. Clear? What is the most common cause of phimosis? It's poor hygiene leading to chronic infection. Chronic infection, and you know that phimosis can be congenital also, it can be acquired also. So, this is phimosis, and you see this one and tell me what is this? Prepuce once retracted cannot be brought back to its normal position. There is edema. So, prepuce once retracted cannot be brought back to its normal position. Guys, it is paraphimosis. बताइए आप लोग, paraphimosis is congenital or acquired? The paraphimosis is congenital or acquired? Yes, tell me, Ehope, Avdesh, Priya, it is acquired. Can you tell me who is responsible for paraphimosis? Paraphimosis is acquired. Who is responsible for paraphimosis? You guys are responsible. Why you guys are responsible? Yes, interns, because you perform Foley's catheterization by no touch technique, and after inserting Foley's, what you do? You forget to bring prepuce to its normal position. So, that is why what happens? Yes, paraphimosis, it is acquired. Acquired. Next, see these two investigations, tell me the name. First, see guys, first one. If you see the first one, here I am going to inject the dye and then dye is going into the bladder. So, this is known as against the flow. आप कुछ भी करेंगे against the flow, उसको बोलते हैं retro. Along the flow it's anti, along the flow anti, against the flow retro. तो आप dye यहाँ prepuce मतलब meter से insert कर रहे हैं and it is going against the flow. This is RGU, retrograde urethrogram. And here you are injecting the dye in bladder and then patient is passing urine, you are going to take serial X-ray. It is MCU, micturating cystourethrogram. So, guys, tell me, where is the stricture here? See these two pictures and tell me, where is the stricture? Which part of urethra is having stricture? Which part of urethra is having stricture? Easy question. You can see the stricture is in bulbar urethra. So, which part? Stricture, it is in bulbar urethra. So, stricture is in bulbar urethra. So, stricture is in bulbar urethra. Got it? So, this is MCU, micturating cystourethrogram. You can see the stricture. Next, this condition is involving the penis. Can you see exophytic lesion? What's the name? Guys, it's dangerous condition. This is known as Buschke-Lowenstein tumor. What is the name? This is Buschke-Lowenstein tumor. So, Buschke-Lowenstein tumor, which is also known as verrucous carcinoma, it is locally malignant. It is locally malignant. So, it is a pre-malignant condition for carcinoma penis, name Buschke-Lowenstein tumor. Okay, Buschke-Lowenstein tumor. Next, see this one. Can you see? There is red velvety plaque involving glans penis. Actually, it's carcinoma in situ involving glans penis. Tell me the name. Waiting for your reply. red velvety plaque involving glans penis. It's carcinoma in situ. What's the name? Dr. Sneha, Rashi, Rathika, Megha. Guys, it is erythroplasia. Redness you can see. So it is erythroplasia of curate. What's the name? This is erythroplasia of curate. Clear? So this is erythroplasia of curate. So that's erythroplasia of curate. Clear? Next, what is the condition? Everything is written. Varicocele. Can you tell me these dilated tortuous pampiniform plexus of vein, what is the location? Can you see? Located posterior and above testis. Posterior and above testis, and we have to ligate the pampiniform plexus of veins. So one question, if you ligate the pampiniform plexus of veins for varicocele treatment, the venous drainage of testis will occur via which vein? What is the alternative venous drainage channel? Easy question. Yes, there is a bag of worm like appearance on palpation. What is the alternative venous drainage channel? Cremastic. Ravi Prakash, Sneha, Block, Ajay Beniwal. Guys, ये INI-CET का question है. This is cremastic vein. So it is occurring via cremastic veins. It is occurring via cremastic veins. So this is varicocele. Next, this question will be asked in exam. We are 100% sure. NEET PG FMG दोनों में इसके बहुत ज़्यादा chances है आने के. What's the name, guys? All of you know, Fourniers gangrene. Fourniers gangrene, and you know it's a type of necrotizing fasciitis. So if it's a type of necrotizing fasciitis, which structures are involved? Structures are involved up to the fascia. So skin, subcutaneous tissue, fascia. What are the structures spared? See this and tell me. Testis spared, cord structure spared, urethra spared, corpora cavernosa spared, corpora spongiosa spared. Corpora cavernosa spared, corpora spongiosa spared. It is polymicrobial. Aerobes, anaerobes, both of these are responsible. And what is the treatment? You can see we have to go for extensive surgical debridement. So extensive surgical debridement should be done. Fourniers gangrene, मैं फिर से बता रहा हूँ, high chances are there that we are going to get a question from Fourniers gangrene. Now see this and tell me. I'm asking two questions. You have to tell me the answer. First, 70 years old chronic smoker male presented with this condition. Tell me what's the diagnosis. 70 years old chronic smoker male presented with this condition. What's the diagnosis? There is gangrene of the toe. It is because of atherosclerosis or Burgess disease. I am giving you the options. Tell me the answer. It is because of atherosclerosis or Burgess disease. Yes, Ajay, Priyanka, very good, very good. Majority of you are marking Burgess. That's wrong. 70 years, atherosclerosis. अगर मैं ऐसा पूछता, if the age is less than 40 years, young male smoker, age less than 40, Burgess. If elderly male smoker is there, what elderly? Atherosclerosis. ये आपको एग्जाम में याद रखना है. You have to look for the age. Guys, ये question आया था. This question was asked in FMG. Majority of students mark Burgess. So young male smoker, yes, go for Burgess, and if elderly male is there, go for atherosclerosis. Next, can you tell me what is this? Punched out ulcer over shin of tibia. Which ulcer? You know, this is arterial ulcer. This is arterial. What are the other features of arterial ulcer? Arterial ulcers की location होती है lateral surface of ankle, distal digits. It is intensely painful because it is ischemic. Can you see the thin shiny skin? Can you see loss of hair? Can you see brittle nails? Can you see loss of toes? So signs of ischemia. दूसरा वाला देख के बताइए. Between medial malleolus and calf, this is known as gaiters region. Between the gaiters region, you can see sloping edges, granulation tissue in the base, granulation tissue in the floor, and hyperpigmented areas. Guys, ये कौन सा ulcer है? This is venous ulcer. Venous ulcer. So it's very easy to identify. Arterial ulcer, venous ulcer. I'm repeating. Arterial ulcer, punched out. intensely painful. Location क्या है? Lateral surface of ankle, distal digits. Loss of hair, shiny skin. Venous ulcer may it is located in gaiters region. There is hyperpigmentation, sloping edges, and in the floor you will see granulation tissue. Clear? Can you tell me, for venous ulcer we follow a regime. What is the name of this regime? Name of the regime for venous ulcer? Guys, you know, we follow Bisgard's. So, what is the name of the regime? It is Bisgard's regime. Bisgard's regime. Clear? Next. What is this? To prevent DVT, we are using this. What is the name? What is the name, guys? I am waiting. This was asked in INI-CET. This is pneumatic compression devices. These are sequential or pneumatic compression devices. Compression devices. Most commonly used method for preventing DVT. So, pneumatic compression devices for intermittent compression, most commonly used method for preventing DVT. Okay. Next, can you tell me the color of this limb? White. This one blue. So, this one, it is painful white leg. This is painful white leg. Both of these are because of DVT. This is painful blue leg. First is known as phlegmasia alba dolens. The second one is known as phlegmasia caerulea dolens. Phlegmasia alba dolens, phlegmasia caerulea dolens. One thing, both these patients are having DVT. Now, you have to tell me which patient is having patent collaterals and which patient is having obstructed collaterals. Patent collaterals, obstructed collaterals. Tell me, guys, which one is having patent collaterals? Tell me first. In white, collaterals are patent, so that the blood is not stagnant, and in the second one, collaterals are also obstructed. That is why deoxygenated blood is collected. So, here these patients have patent collaterals. Alba dolens, patent collaterals, right? And you know, caerulea dolens, obstructed collaterals. Caerulea dolens, these patients have obstructed collaterals. Easy? Obstructed collaterals. Okay. Next, guys, tell me the diagnosis. Just by looking at the image, you can make the diagnosis. All of you know. This is filariasis, especially elephantiasis. And can you tell me what is the organism responsible for filariasis? Wuchereria bancrofti. Wuchereria bancrofti. Especially if you see this part of foot. Can you see this? Dorsum of foot. You can see the swelling over dorsum of foot. Can you see this? What is the name? Name of this swelling over dorsum of foot. Can you tell me, guys? What is the name of this swelling over dorsum of foot? Waiting for your reply. Yes, easy. Sultan. No. Ravi Prakash. What is the name? Hump. Yes, it's a hump. Tell me which hump. Not elephant hump. Which hump? Chetna, buffalo hump. Guys, it's buffalo hump. So, you can see here, there is buffalo hump here. This is known as stemmer sign. The skin overlying the toes cannot be pinched. That is known as stemmer sign. So, skin overlying the toes cannot be pinched. This is stemmer sign. And the swelling is known as, you can see, swelling. This is known as buffalo hump. Buffalo hump. And here, can you see square shaped toes? This is known as squaring of toes. This is known as squaring of toes. Squaring of toes. So, I am repeating, there is stemmer sign, skin overlying the toes cannot be pinched, swelling over the dorsum of foot, that is known as buffalo hump, and squaring of toes because of prolonged confinement of foot into footwear. Okay. Now, you can see this one, easiest question, though you are not going to get an X-ray in the exam, but sometimes examiners are giving this X-ray. See the finding. Tell me. There is shift of mediastinum. Can you see this? Collapsed lung. There is depressed diaphragm. Guys, what is the diagnosis? और मैं आपको बता रहा हूँ 100% चांसेस है there will be one question from tension pneumothorax. 100% चांस है you will get a question from tension pneumothorax. So it is tension pneumothorax. क्या question आएगा? Clinical description will be there. After that, what is the treatment? So immediate treatment, put a wide bore needle in 5th intercostal space in anterior axillary line, not mid axillary line, एंटीरियर एक्सिलरी लाइन, ठीक है. इन एडल्ट्स सेकेंड इंटरकॉस्टल स्पेस इन मिड क्लेविकुलर लाइन. इन चिल्ड्रन और ट्रीटमेंट ऑफ चॉइस क्या है? ट्रीटमेंट ऑफ चॉइस इज ICD insertion. So treatment of choice is ICD insertion in fifth intercostal space in anterior axillary line. अब आप लोग कंफ्यूज कहाँ होंगे, मैं आपको क्वेश्चन बता देता हूँ. सी, इफ अ पेशेंट ऑफ ट्रॉमा इज ब्रॉट टू योर इमरजेंसी, neck veins are collapsed. Second, a trauma patient is brought to emergency, neck veins are distended. Both of these patients are in the state of shock. Tell me which patient is having tension pneumothorax, which patient is having hypovolemic shock. Distended neck veins, it is because of tension pneumothorax or hypovolemic shock. Waiting for your reply. Let me see who is the genius. Distended neck veins, it is because of tension pneumothorax or because of hypovolemic shock. Yes, engorged means tension pneumothorax. Why? देखिए, tension pneumothorax में what happens? There is compression of superior vena cava and inferior vena cava. Can you see here? So if IVC is compressed, what will happen? There is decreased venous return. Superior vena cava is compressed, there is decreased venous return. But since superior vena cava is compressed, there is distended neck veins. इसीलिए when you suspect tension pneumothorax, on the basis of suspicion, put a wide bore needle in the fifth intercostal space. लेकिन अगर hypovolemic shock का patient है, उस केस में you have to give IV fluids. So this is how you can differentiate. ठीक है. दूसरा टेंशन pneumothorax में what else will be there? Patient will be having dyspnea, patient will be having tachypnea, there is hyperresonance, absent breath sounds. मैं आपको फिर से बता रहा हूँ 100% chances are there that you will get a question from tension pneumothorax. Okay, next. Guys, tell me what's the name of this easiest question. This was asked multiple times in multiple exams. What's the name of this knife? This is Humvee knife. And this is electric dermatome. You have to tell me the uses. Humvee knife and electric dermatome. Clear? So you know the uses. Humvee knife as well as electric dermatome, both of these are used for harvesting the skin graft. So both of you, these are used for harvesting skin graft. Skin graft. Clear? Humvee knife, electric dermatome. Next, tell me what's the name of this condition? In the scalp, this patient is having a tumor-like condition. Can you see? This is a tumor-like condition known as Cox peculiar tumor. What is this Cox peculiar tumor? Can you tell me guys what is this? It's carbuncle, very bad. Carbuncle की position क्या होती है? Carbuncle is seen over the nape of neck in diabetic patient. ये scalp में है. Cox peculiar tumor. This is infected sebaceous cyst of scalp. Infected sebaceous cyst. So guys, this is infected sebaceous cyst of scalp. Sebaceous cyst of scalp. Clear? Cox peculiar tumor. One liner question. Next, tell me this one. This is Pott's puffy tumor. Pott's puffy tumor. Here because of osteomyelitis. यहाँ बताइए कौन सी bone involved है? Guys, tell me this is Pott's puffy tumor. So this is Pott's puffy tumor, right? Which bone is involved here? Yes, tell me. Just by looking at the image, you can tell me there is involvement of frontal bone. So there is osteomyelitis of which bone? Osteomyelitis of frontal bone. So this is Pott's puffy tumor because of involvement of frontal bone. Easy. Now see the next one. This is spot diagnosis. You can see here black colored punctum. Guys, tell me what's the name of this condition? Punctum is there. What's the diagnosis? Tell me. Punctum, sebaceous cyst. Since the patient is having sebaceous cyst, can you tell me everywhere if the sebaceous cyst is there, the characteristic feature is punctum, but there are two exceptions. At two places there is no punctum. Can you tell me what are those two exceptions where no punctum is there? Easy question. Scalp, no punctum. स्क्रोटम नो पंक्टम. आप लोगों ने देखा होगा कुछ लोगों के यहाँ फोरहेड पे एक सी स्वेलिंग होती है ऐसे हेडलाइट जैसी, ठीक है, वो निकलवाते भी नहीं, लंबे समय से बड़ी स्वेलिंग होती है, 50-60 की एज होती है ऐसे लोगों की. व्हाट? दिस इज नॉट हैविंग एनी पंक्टम बिकॉज इट इज इन द स्कैल्प, फोरहेड. यहाँ पे स्क्रोटम में भी बहुत सारे लोगों को सिस्ट होता है, इट इज नॉट हैविंग एनी पंक्टम. सो इन स्कैल्प एंड स्क्रोटम नो पंक्टम. सो दिस इज सेबाशियस सिस्ट. ट्रीटमेंट, you have to excise the cyst along with its wall. This is the famous question which was asked multiple times. ये बच्चे की इमेज आती है, बताइए जरा. Near outer angle of eye, near eyebrow, can you see patient is having dermoid? Guys, can you tell me the name? Priyansh, you tell me. Rohan, Dr. J, what is the diagnosis, guys? This is angular dermoid. And what is the question which is asked in exam? They ask that what is the treatment of this angular dermoid? We go for surgical excision. So the treatment of this angular dermoid, we go for surgical excision. Clear? Surgical excision. This is not dermoid cyst, angular dermoid. So treatment is surgical excision. Clear? Next, 100% हम लोग sure हैं that we are going to get this question. Tell me, guys. This patient was immobilized in one particular position, supine position for long duration, and patient is having this pressure ulcer. You can see there is underlying muscle, or sometimes you can see the bone. बताइए जरा, what is the stage of this pressure ulcer? Bed sore? Yes, you are correct. I am not asking. I am asking the stage 1, 2, 3, 4. What is the stage of this pressure ulcer, guys? If the bone is visible, muscle is visible. Priyansh first person, रुद्राक्ष सेकेंड, देवजनी हल्देर, गाइस स्टेज 4. मैं आपको एक ट्रिक बता देता हूँ, इट्स वेरी इजी टू रिमेंबर. व्हाट इज़ द स्टेज? वेरी इजी. दो चीज़ें आप इजीली आसानी से याद कर सकते हैं. देखिए, द ग्रेडिंग ऑफ बर्न क्लासिफिकेशन और प्रेशर अल्सर क्लासिफिकेशन इज ऑलमोस्ट सेम. ठीक है, मैं आपको क्लू बता देता हूँ. इन बर्न्स देर इज इन्वॉल्वमेंट ऑफ एपिडर्मिस, इट इज़ फर्स्ट डिग्री. And in pressure ulcer, if there is erythema involving epidermis, it is stage 1. Stage 1 में किसका involvement होगा? Epidermis. In stage 2, there is involvement of epidermis plus dermis. In stage 3, there is involvement of subcutaneous fat. In stage 4, there is stage involvement of muscle or bone. ठीक है? Now see the burn classification, first degree. Burn classification, burns involving epidermis, first degree. That's why it is known as epidermal burn. Second degree, partial thickness burn, where there is involvement of epidermis plus dermis. Third degree is full thickness burn. So whenever full thickness of skin is involved by burns, it is full thickness burn. और अगर ulcer है, there is involvement of epidermis, dermis and subcutaneous fat or tissue. It is third stage 3 pressure ulcer. And whenever you see muscle, you can see the bone, it is stage 4 pressure ulcer, or whenever in burns there is involvement of muscle or bone, it is 4th degree. You got it? Everybody understood? Anybody is having confusion? क्योंकि ये दोनों question आता है, I am repeating, I am telling you. Everybody understood the burn classification and this pressure ulcer staging? Anybody is having any confusion? Let's revise quickly. Okay? So let's revise quickly, guys. Epidermis, first degree or stage 1. Epidermis plus dermis, second degree or stage 2. Epidermis plus dermis plus subcutaneous fat or tissue, third degree or stage 3. Involvement of muscle or bone or exposed muscle or bone. What is that? 4th degree or stage 4. मैं आपको क्वेश्चन बताता हूँ. ज़्यादातर एग्जामिनर्स कौन सा क्वेश्चन पूछते हैं? दे गिव द पेशेंट हुज सेक्रम इज एक्सपोज्ड, और ज़्यादातर केसेस में आपको सेक्रम दिखाई देगा. राइट? सो ऑब्वियसली व्हाट स्टेज ऑफ प्रेशर अल्सर इज दिस, गाइस? द स्टेज इज 4. तो ये क्वेश्चन गलत नहीं होना चाहिए. राइट? सो इट्स वेरी इजी. प्रेशर अल्सर मैं फिर से बता रहा हूँ, वी आर एक्सपेक्टिंग अ क्वेश्चन. नाउ कैन यू टेल मी, गाइस? यस, नियर नोज, near inner canthus, you can see this malignancy. It is having pearly white nodules in the periphery with central depression, dilated vessels over the surface. बताइए जरा कौन सी malignancy है? Basal cell carcinoma. All of you know it is also known as rodent ulcer. Why it is known as basal cell carcinoma? Because it arises from basal layer. What is the most common type of basal cell carcinoma, guys? Nodular variety. And in nodular variety, all of you know, there is pearly white nodules in the periphery with central umbilication or central depression. Clear? Most common site, nose followed by inner canthus. Basal cell. ये वाला देखिए और बताइए, what is this? Can you see the color? Can you see the diameter? Border? Yes. What is the diagnosis, guys? Tell me. Priya, Ayush, tell me the diagnosis. Guys, tell me the diagnosis. Melanoma, malignant melanoma. And you know that malignant melanoma, it is characterized by A, B, C, D, E. You have to tell me the full form. A, B, C, D, E. A, B, C, D, E. A, that is asymmetry. So you know that A, that's asymmetry. You know B, B, that's border irregularity. So this is border irregularity. Irregularity. C, that's color variation. Is the color variation. D, change in diameter more than 6 mm. E, there is evolution in shape, size and color. So got it? A, B, C, D, E. ट्रॉमा में भी होता है ATLS प्रोटोकॉल A, B, C, D, E. One question for all of you. A, B, C, D, E, F. It is followed in which condition? A, B, C, D, E, F. A, B, C, D, E, F. It is followed in which condition? A, B, C, D, E, F. F burns. F का मतलब है fluid. बाकी ए बी सी डी का मतलब है ए एयरवे, बी ब्रीदिंग, सी सर्कुलेशन, डी डिसेबिलिटी, ई एक्सपोजर, एफ मतलब फ्लूइड. ए बी सी डी ई एफ ये बर्न्स में फॉलो करते हैं हम लोग. ओके बर्न्स में. नेक्स्ट कैन यू सी गाइज व्हाट इज द नेम ऑफ दिस? Here you can notice that in this image you can notice that the skin and subcutaneous fat, it is stripped by avulsion from underlying fascia. What is the name of this injury? इसको बोलते हैं हम लोग degloving. So you know what's the name of this injury? This is degloving injury in which skin plus subcutaneous fat, it is stripped from underlying fascia. So skin and subcutaneous fat, it is stripped from underlying fascia. This is degloving. किस में होता है? It is crush injury. कभी टायर चढ़ जाता है, उस केसेस में you are going to find this kind of degloving injury. This was image based question. Next guys, tell me what is the name of this condition? In both of these cases there is excessive scar tissue. Here this is hypertrophic scar because excessive scar tissue, it is within the wound margin or within the incision. Here it is going to extend beyond the incision. Since it is going to extend beyond the incision, all of you know this is keloid. आप लोग बताइए what is the most common site of keloid? See the image and tell me. Most common site of keloid. Guys, see the image and tell me. The most common site of keloid, this is sternum. So you know it is sternum. ज़्यादातर it is seen in darkly pigmented races. So you can see this is hypertrophic scar. This one is keloid. So hypertrophic scar and keloid. Okay. Next. This is one of the frequently asked question. You can see ecchymosis or mastoid or in post-auricular region or behind ear. What is the name? इसका मतलब युद्ध हुआ है. Significant injury हुआ है तो युद्ध हुआ है. Tell me the name of this sign. अगर युद्ध हुआ है तो tell me the name of this sign. Guys, battle sign. So whenever there is ecchymosis or mastoid or in the post-auricular region behind the ear, इसका मतलब समझ जाइए युद्ध हुआ है. This is battle sign. Battle sign and it is seen in which cranial fossa fracture? बीच में युद्ध हुआ है. Middle cranial fossa fracture. दो लोगों के बीच में युद्ध हुआ है. दो लोगों के बीच में middle cranial fossa fracture. This is battle sign. Middle cranial fossa fracture. This is battle sign. Okay. Next. ये 100% चांस है you will get this question in exam. Image based question आएगा. आप देखिए what is this? Biconvex hyperdense lesion. Crescent shaped hyperdense lesion. आपको पता है this is EDH, extradural hematoma. This is SDH, subdural hematoma. EDH, it is because of injury of guys middle meningeal artery. SDH because of injury of cortical veins or bridging veins. Cortical veins or bridging veins. Bridging veins, clear? And can you tell me in which one lucid interval is positive? Lucid interval is positive in EDH. So lucid interval. Where is the injury in EDH? Weakest point of skull. What's the weakest point of skull, guys? You know it's pterion. Pterion. So here it is biconvex. Here concavo-convex or crescent shaped. दोनों में investigation of choice same. NCCT treatment क्या करेंगे? Drain it by burr hole or craniotomy. So drain it by burr hole or craniotomy. मैं फिर से बता रहा हूँ. Definitely this question will be there in exam. So EDH, SDH. Okay. Next. ये बताइए it's a tumor. This tumor crosses midline. It looks like butterfly. Tell me guys which one? What's the name? There is central necrosis with ring-like enhancement. Tumor crosses midline, central necrosis with ring-like enhancement. Everybody is correct. Yes, GBM, glioblastoma multiforme. So this is glioblastoma multiforme. Glioblastoma multiforme, you know it crosses midline it crosses midline. That's why it is also known as butterfly tumor. This is butterfly, crosses midline. So, this is also known as butterfly tumor, and you can see here there is central necrosis with ring-like enhancement. This is most malignant astrocytoma having worse prognosis. Most common type of astrocytoma, this is glioblastoma multiforme. See this one and tell me, easiest question, you can see the tail. So, guys, you can see the tail. This is arising from dural tail, and all of you know that this dural tail sign, it is seen in meningioma. So, dural tail sign, it is seen in meningioma. So, this is meningioma, you can see here, this is dural tail sign seen in meningioma. Dural tail sign seen in meningioma, clear? Now, see the next one. Very easy, we are expecting one question out of these three images, guys. Tell me first one, can you see this whitish patch which cannot be rubbed off? This is leuco. Whitish patch which cannot be rubbed off, this is leukoplakia. You can see here, this is reddish mucosal plaque. You know what's the name? Erythroplakia. So, this is reddish mucosal plaque, the name is erythroplakia, and you can see this one, whitish patch intermingled with reddish plaque, this is speckled erythroplakia. This is known as speckled erythroplakia. अब आप लोग मुझे बताइए, which one is having maximum risk of malignancy? Question for all of you. Which one is having maximum risk of malignancy? Devjani Halder, correct. Speckled erythroplakia followed by erythroplakia followed by leukoplakia. मतलब least risk in leukoplakia, maximum risk speckled erythroplakia. Erythroplakia, speckled erythroplakia को याद करने का आसान तरीका बताता हूँ. There is leukoplakia also, erythroplakia also. That's why the name is erythroleukoplakia. What is the name of speckled erythroplakia? Whitish patch is there, reddish mucosal plaque is there, so name is erythroleukoplakia. Guys, so this is how you will remember. Next question, easy. Tell me, where is the tumor? Where is the tumor, and which tumor is this? Parotid tumor. Can you tell me what is the most common parotid tumor? Guys, tell me, what is the most common parotid tumor? This is pleomorphic adenoma. So, this is pleomorphic adenoma. Can you see the typical location? It is located in front, below, behind ear lobule pushing it up, in front, below, behind ear lobule pushing it up. So, this is pleomorphic adenoma, right? Now, see the next one. Guys, tell me what is the name of this condition? Name of this condition, all of you know, what's the name? Ranula. It resembles frog's belly, located just below tongue. Just below means below tongue. Sublingual, sub means below, lingual means tongue. Sublingual gland. So, arising from sublingual gland. You give the incision and what you do? You suture the wall in surrounding. So, आप wall को surrounding में suture कर दीजिए. So, what is the name of this treatment? This is known as marsupialization. So, the name marsupialization, right? If you are going to tell this word to some non-medico, आप किसी non-medico को बोल दीजिए marsupialization, उसको लगेगा कि गाली दे रहा है, ऐसा सोचेगा कि AG गाली दे रहा है. Clear? So, it is marsupialization. Okay? What's the treatment? Marsupialization in ranula. Next, guys, see this and tell me, what is this? Cystic hygroma. Cystic hygroma. What is the location of cystic hygroma? Can you tell me? Cystic hygroma. Most common site, आप देख के बता दीजिए. Yes, most common site, guys, cystic hygroma. Tell me, most common site. Posterior triangle of neck, and this is posterior triangle of neck. Posterior triangle of neck. It is brilliantly translucent. This is brilliantly translucent. How to make the diagnosis? MRI. And what's the treatment? We have to go for surgical excision. So, surgical excision, और आपको पता है it is associated with Turner syndrome. Associated with Turner syndrome. So, this is cystic hygroma. Clear? Cystic hygroma. बहुत सारी बुक्स में लिखा है ट्रांस इल्यूमिनेंट. नो, मेनिंगोसील इज ब्रिलियंटली ट्रांस इल्यूमिनेंट. ये है ब्रिलियंटली ट्रांसलूसेंट. दिस इज ब्रिलियंटली ट्रांसलूसेंट. क्लियर? brilliantly translucent. Now see this next one. Can you tell me that guys, what's the diagnosis here? Sacrococcygeal teratoma. आप देख सकते हैं, it is arising from sacrococcygeal region. Neonates में होता है sacrococcygeal teratoma. Tell me it's benign or malignant? Guys, tell me. Benign. This question was asked that it arises from primitive streak. It arises from primitive streak. Here also what's the treatment? The treatment is complete surgical excision with, नाम है sacrococcygeal teratoma, excise the coccyx to prevent the recurrence. So surgical excision with complete excision of coccyx. So it's the surgical excision with excision of coccyx. Sacrococcygeal teratoma कहाँ से arise करता है? It's a derivative of primitive streak. Okay. Now see the next one. Sutures very important. ये देखिए जरा yellow color का. What's the name? Catgut. Catgut is not the catgut. It is sheep gut prepared from sheep's ileum, कौन सी layer? Submucosa. Guys, tell me in how many days catgut is absorbed? Catgut absorbed in 60 days. Can you tell me what is the preservative used? Preservative used. Guys, tell me. Preservative used isopropyl alcohol. So preservative used, that is isopropyl alcohol. This is catgut. Catgut. 60 days. Okay. After that, you can see this is Vicryl. What is the other name? Polyglactin. Vicryl is polyglactin. Yes. In how many days it is absorbed? It is absorbed in, tell me guys, 60 to 90 days. It is workhorse suture of general surgeon. किसके लिए use करते हैं? Any organ in which there is formation or tendency of stone formation. Mnemonic is cub. So in which organs we are using Vicryl? Cub. Cub. C means CBD, U means ureter, B means bladder. So it is CBD, ureter, bladder. Apart from bladder, it is also used in bowel anastomosis. So CBD, ureter, bladder. Apart from that, we are using it in bowel anastomosis. So cub, that is Vicryl, also known as polyglactin. This is polyglactin. Okay. Next, guys, can you tell me blue colored? What is the name? Proline. Proline is polypropylene. It is non-absorbable suture. आप लोग जरा uses बताइए कहाँ कहाँ use करते हैं proline? Proline special uses vascular anastomosis. So guys, what are the uses? Used in vascular anastomosis. दूसरा, it is used for closure of rectus sheath. We are using it for closure of rectus sheath, and in hernia surgery for mesh fixation. Very good. Dhwani, Shalu, Priya, Devas, Sauvik, Ahope, Priya, Chetna, everybody is correct. So for hernia surgery for mesh fixation we are using proline. What is the color of proline suture, guys? Blue. It is blue. Now see this one. Knot. How to identify the knot? Right? Remember, if two people are together, दो लोग अगर साथ साथ है वो काफ़ी strong होंगे, stable होंगे, और दो लोग अगर ऊपर नीचे हैं मतलब साथ नहीं है, क्लियर, इसका मतलब स्टेबल नहीं होंगे. इसमें आप देख सकते हैं both these red ends are together and these two blue ends are together. ये दोनों blue वाला red के नीचे है. Both these reds are above the blue. This is square knot or reef knot. Easy to identify. Square or reef knot. It is stable. Clear? You can see here this blue one, it is below red and this blue one is above red. यहाँ देखिए ये red है, it is above this blue, और ये वाला red it's below the blue. So both ends are like this. Can you see here? It's like this. Can you see? So this is pseudo square knot or Graney's knot. और अगर दोनों एक साथ हैं या तो ऊपर या दोनों एक साथ नीचे हैं. So this is Graney's knot, easiest to identify, also known as pseudo square knot. Pseudo square knot. Pseudo square knot. Clear? So this is how you can easily identify the knots. These are asked frequently. So Graney's knot, pseudo square knot, square or reef knot, this is stable. Graney's या pseudo square knot unstable. दूसरा, nowadays they are asking the sutures. At what degree the suture should or needle should pierce during suturing? Simple interpreted suturing, 90 degree. Whenever the needle is piercing the skin at 90 degree, after that you are moving the needle horizontally. If your needle is moving horizontally, it is known as horizontal mattress. Needle is moving vertically, vertical mattress. याद करने का तरीका बता देता हूँ. This is the line of incision. if your suture is parallel to the line of incision, it is horizontal mattress. This is the line of incision. If your suture is perpendicular to line of incision, this is vertical mattress. So, easiest, this is horizontal mattress, this is vertical mattress. So, horizontal mattress, vertical mattress. In horizontal mattress, the suture is parallel to the line of incision, vertical mattress perpendicular to the line of incision. Mattress suture क्यों लगाते हैं? Whenever there is uneven edges, to approximate the uneven edges, we are using mattress suture. Clear? Now guys, see this one, very important, कई बार आ चुका है. If you see the first, there is involvement of cheeks, face, bridge of nose, and here well defined margins are there. Can you tell me what's the name of this condition? Well defined margins, involvement of cheeks, face, bridge of nose. What is this? Erysipelas. This is erysipelas. And you can see the second one, there is involvement of leg, there is ill defined margins. What is the name? Cellulitis. Guys, what is the similarity between both? In both the organism is same, strep pyogens, most common organism, strep pyogens. You have to tell me vesicles and bulla, these are more common in erysipelas or cellulitis. I am asking, yes, tell me the reply. What is the correct answer? Vesicles and bulla, these are common in erysipelas or cellulitis. Ravi Prakash, yes, erysipelas. Vesicles and bullas are not very common in cellulitis. So, this is erysipelas, well defined margin, cellulitis, ill defined margin, most common site erysipelas, face, cheeks, bridge of nose, cellulitis आपने देखा होगा emergency में, where you are going to find legs. ठीक है? Next, guys, you are going to get one question at least either from cannula or color coding of Foley's. थोड़ा सा Foley's का color coding देख लीजिए. It's very easy, you know. You can see here color coding, grey 10 French, white 12, green 14, orange 16, red is 18, yellow is 20, violet 22, and the blue is 24. Clear? So, how to remember? Actually, it's very easy to remember. The mnemonic is grey, white, gory, valentine, babe. So, it is, you can see here, mnemonic easy. It is grey, white, gory, you can see here. So, grey, white, gory, valentine, babe. Grey 10, white 12, gory, G means green, 14, O means orange, 16, R means red, 18, Y means yellow. Gory 14, 16, 18, 20, Valentine is violet, babe is blue. ये याद ही होना चाहिए, आई एम टेलिंग यू. आपको वैलेंटाइंस डे याद रहता है, लेकिन ये वैलेंटाइन बेब भी आपको याद होनी चाहिए. सो ग्रे वाइट गोरी वैलेंटाइन बेब. क्लियर? ग्रे 10, वाइट 12, gory green is 14, orange 16, red 18, yellow 20, violet is valentine, that is 22, right, and blue, that is 24. Okay, so ये Foley's का है. अब जरा कैनुलास का देखिए. कैनुलास very important, हर साल एग्जाम में आता है. Every year almost you are going to get at least one question in one exam. जरा देखिए. Orange is 14, here you can see grey is 16, green 18, pink 20, blue 22, yellow is 24, violet 26. ठीक है? यहाँ याद करने का आसान तरीका. Here also the mnemonic is there. O great God, please bless your people. So, O great God, please bless your people. O means orange 14, great grey 16, green 18, God, please that is pink 20, bless blue 22, your yellow 24, purple or violet, that is 26. I am repeating, there will be questions related to color coding. Okay? Now see the next one. Guys, see some instruments which are very hot. Can you tell me the name of this needle? What is the name of this needle? Hot instruments, this is Viris needle. Multiple times this question was asked in exam. Viris needle, it is used for creating pneumoperitoneum by which method? Closed method. So, for creation of pneumoperitoneum, used for creation of pneumoperitoneum by closed method. This is Viris needle. Viris. Now, you have to tell me the names of instrument. I am going to tell you the clues, tell me the name. There is a tooth, there is a groove. On one blade, tooth, groove. What kind of serrations are there? there are transverse serrations in the blade. There are transverse serrations. Guys, tell me what's the name of this instrument? Name of, very good, everybody is correct. This is Cocker's hemostatic forceps. What's the name? Cocker's. So, the name is, this is Cocker's hemostatic forceps. So, this is Cocker's hemostatic forceps, hemostatic forceps, clear. So, this is Cocker's hemostatic forceps. What is the use? In depth you want to catch a bleeder during mastectomy, in the palm and soles you are using it. If you want to crush something like during appendectomy, you want to crush the base, you are using Cocker's hemostatic forceps. Next, tell me guys, what's the name of this instrument? It is having a curve, there is a fenestration. What's the name? Guys, tell me the name. Name, Babcock's forceps. Babcock's, very good. Devjani, Kishore, Amiya, Sharat, Tanya, Megha, Babcock's forceps. It is non-traumatic instrument. There is a space, so it can accommodate something. What it is going to accommodate? Can you tell me? Some tubular structures. So, can you tell me what are those tubular structures? Ureter, fallopian tubes, ureter, fallopian tubes, appendix it can accommodate. So, this is Babcock's tissue forceps. Next, can you see this? This is used for cleaning, and you can hold the sponge and you can swab an abscess cavity. Guys, tell me the name. Yes, tell me the name. Rampley's sponge holding forceps. So, this is Rampley's. So, this is Rampley's sponge holding forceps, clear. So, this is Rampley's sponge holding forceps or sponge holder. इसका use क्या होता है? Obviously, it is used for cleaning the patient, to swab an abscess cavity, and during open cholecystectomy it is used to hold the fundus of gallbladder. Next, tell me, magical instrument. Yes, especially for major abdominal surgeries, malignancy surgeries, hepatectomy, gastrectomy, gastrojejunostomy we are using. Guys, tell me what's the name? Yes, Tanya, Kishore, this is Devers. This is Devers retractor. Devers retractor. So, for major intra-abdominal surgeries we are using to retract the liver, to retract the bowel, to retract the stomach. For major intra-abdominal surgeries we are using Devers. Now, see this one. Tell me, it is used in gynae also and used during laparoscopic cholecystectomy also for removing the stone from the gallbladder during extraction. Tell me the name. Can you see the spoon shaped tip and fenestration? Ovum forceps. So, what's the name? This is ovum forceps. Ovum forceps. Clear? So, how to identify? There is fenestration. There is fenestration with spoon shaped tip. Clear? This is used during DNC. It is used during extraction of gallbladder. When some stones are there in the gallbladder, we have to remove the stones. Ovum forceps. Next, this was asked multiple times guys. थोड़ा सा देखिए इसको ध्यान से. Two blades are there. There is the solid blade with curved tip and there is biflank blade. इसका नाम बताइए. What's the name? Devjani, very good. Devjani, most of the times you are correct. This is Journey's retractor. Journey's retractor. So, during hernia surgery, mastectomy, thyroidectomy, we have to use it for retraction. Retraction. And whenever you are closing the rectus sheath, yes, you are passing the needle. So, to take the suture, we are using this biflank blade. Naam hai Journey's. Very similar to Journey's solid blade. You can see this one. But this is having wider blade. There is more concavity and curved tip. There is serrated handle with fenestration. Okay. Let me see who is going to reply this. What is the name? Yes. Very good. This is Morris retractor. This is Morris. This is Morris retractor. It is having wider blade. There is concavity for more space and there is curved tip. Curved tip. A NEET PG का question है. This is Morris retractor. Guys, you can see this one. This is stone holding forceps. How to identify stone holding forceps? Can you see? There is fenestration so that it can accommodate the stone. There is no catch. So, there is no catch. So, it is not going to crush the stone. And you can see there is curvature, angulation so that you can work in the depth. So, this is stone holdings. No, this is not Desjardins. It is very similar to Desjardins, but it is not Desjardins. It is for kidney. Now, tell me the name. Let me see who is the genius over here. This is not for CBD stone. This is for kidney stone. So, tell me the name guys. What's the name? Name is Rendall's kidney stone forceps. This is Rendall's kidney stone forceps. Kidney stone forceps. Yes, Desjardins is for CBD. CBD में इतना ज़्यादा angulation नहीं होता. CBD में भी angulation होता है. In Desjardins also there is angulation, but this much angulation is not there. In Rendall's multiple angulations are there. So this is Rendall's kidney stone forceps. Next, guys, see this one, easiest. बताइए यहाँ we are using it here. Tell me, easiest. This one is easiest. Jawl's, very good. Tanya, very good. This is Jawl's thyroid retractor. So this is Jawl's. Jawl's thyroid retractor. Actually, it is self-retaining retractor. So Jawl's thyroid retractor. So after incision, what happens? You are going to apply these towel clip-like forceps. So that what happens? It is going to open the incision. It is for superior and inferior flap. So this is Jawl's thyroid retractor. And can you see this one? You have seen this instrument in minor OT. There is curved angulated tip, alternate teeth and groove, and there is a gap with long straight blade, so that you can retract the skin and subcutaneous tissue. This is Ellis tissue forceps. Can you tell me the uses? Guys, tell me the uses. This is Ellis tissue forceps. Ellis tissue forceps. Ellis tissue forceps. So during minor OT surgery for sebaceous cyst excision, lymph node excision, lipoma excision, we are using it, Ellis tissue forceps. Clear? To hold the tough structures also, yes, Ellis tissue forceps are used. Okay, next, this was asked in one of the latest exam. Can you see? Yes, you can see here that the terminal part of blade, it is having, or it is at right angle to rest of the blade. So terminal part of blade is at right angle to rest of the blade. Obviously, what's the name? Right angle. Can you tell me the name? Apart from right angle, what are the other names? Right angle forceps, also known as Lahi. What is the other name? Lahi or mixture artery forceps. So Lahi or mixture artery forceps. So Lahi or mixture artery forceps. Can you tell me the use? Yes, you know that this right angle forceps is the surgeon's friend. So if you want to catch something in the depth, you want to catch the bleeder in depth, you can use it. During dissection of pedicle, you can use it. During open cholecystectomy to pass ligature, we are using it. So this is right angle Lahi or mixture artery forceps, right? So guys, these were the important images, okay? So keep studying at this pace only, right? Put your 100% for the preparation. Last these some days are these 1 month or 20 days, 15 days, these are most important days. Put your 100% and definitely you are going to crack this exam with flying colors. Our best wishes are with you. The whole PrepLadder family is with you. Good luck, guys. Good luck.